Here you go.
So first of all, my name is Christian Maxey. I'm a licensed clinical social worker. Can you guys hear me okay?
Yep.
Okay. So when Jamie contacted me about this, I was kind of excited because trauma is one of my big focuses. I started out in the social work field about 10 years ago, and one of my first jobs was actually working with the foster kids over here at Faith Foundation with the Chagin program. So over the past 10 years, I worked with a lot of kids who have experienced trauma. It wasn't until 2014 that I went back to school and actually got my bachelor's in social work, and then a master's in social work, and now I'm a therapist. So currently I work full-time at Presbyterian Children's Homes and Services, and I work, so I do community resource coordination, and I also do therapy. So I work with a lot of kids that are in foster care that have been through severe trauma. So very familiar with working hands-on with kids. So it's kind of, Jamie asked, I went through special training for this, but in college, I was part of the behavioral health education workforce training through Mizzou and UMSL. So trauma has been one of the biggest focuses of my career. So even though I've been in the social work field for about 10 years, I've only technically been a social worker for 4 because you can't call yourself a social worker unless you have a BSW or MSW. So, and this is my first time presenting at a school. So I tend to talk fast when I get nervous, and I have anxiety myself. So if I talk too fast, just say, "Hey, Chris, slow down." So Jamie asked for 3 hours of content, and I hope I have 3 hours. So
We can always get off subject and talk a lot.
Yeah.
well, I'm hoping we do have some good discussions. So I'm going to start with this video for the. Have you guys heard of that book that Oprah and Dr. Bruce Perry put out?
No.
How does understanding what happened to a child bring clarity to why a child purposely passed out?
A lot of times when a teacher has a child who acts out as a class, they feel as if it's personalized, as if the misbehavior is directed towards them. And in fact, very rarely is. If a child has a history of trauma, it's because the behavior is kind of a manifestation at times of the fight or flight response. Whether it's physical proximity becomes an evocative cue. Every time any other adult got close to me and came up behind me, they were going to hurt me. So when the teacher comes up on my shoulder to try to help me, and they blow up and say, "Get away from me," that's basically a completely predictable defensive behavior by the child, but a completely confusing aggressive behavior to the teacher. And again, one of the things that we've been able to do with educators is that we teach them about trauma and about these responses. They begin to shift the way they understand the child. They no longer take it personally. They ask what happened to you. Sometimes they may not know what happened, but they realize something did happen.
Something happened.
Yeah, and so they can then change the way they treat it.
How does understanding what happened to a child
Alright, so it doesn't like my clicker. Okay, so trauma is an event, a series of events, or a set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening that has been and that has lasting adverse effects on the individual's functioning, mental, physical, social, emotional, and spiritual well-being. So 3 key things about about trauma to keep in mind is that there's really 3 components of a traumatic event that's important to understand. Is the event itself, which is the actual extreme threat or physical or psychological harm, withholding material, or relational resources. And then there's the experience, how the individual assigns meaning to that event or labels the event. So two people can experience the same event, and one can be traumatized by it, one could not be, just depending on how they perceive it, based on their nurture, based on nature, just depending on their resilience. So two people can really, a group of people can go through the same event and have totally different experiences. So, but the effects is the result of the individual's experience of the event. So something that we could all think of as 9/11, okay? When that terrorist attack happened, people experienced that differently. If you were on ground zero or if you were there, it was probably more traumatic than if you just heard about it on the news. But as a nation, we all went through that trauma. So it's really important when you're thinking about trauma, you get to keep those three components in mind: the event, the experience, and the effect.
First, real quick, when you click that, did it,
Yeah, just hit it.
so it's still recording?
Yeah.
Okay.
So trauma impacts people from all walks of life. Approximately, and depending on which research you look at, some people will say half of the kids you come in contact with, but most generally the most accepted statistic is 2/3 of the children have experienced at least one traumatic event before the age of 17. Some minority groups are considered more at risk than others. So I know, like, just one that comes to my mind is like the LGBTQI plus population. They're more at risk for trauma than somebody who's not in that classification. They have a higher risk for suicide, they have a higher risk for being bullied, so they're a more at-risk population. Exposure to trauma changes the brain, and that happens even after the traumatic event. So something to keep in mind about trauma is trauma can actually happen when the baby is in the mother's womb, whether it's substance abuse, domestic violence, poor nutrition. So there's prenatal trauma, which means that baby's already born with trauma in their life. Trauma affects all domains of life. I think the ones that are important for this setting is to think about relationships, emotional behavioral regulation, attention and concentration, education, employment, and then overall mental health and substance abuse. So there's three different types of trauma, three main types of trauma, and then there's several other types of trauma. So acute trauma is exposed to a single overwhelming event. So examples of this could be rape, death of a loved one, natural disaster, etc. So characteristics you might see in a child who's experienced something like this is they have detailed memories, omens, hypervigilance, exaggerated startle response, misperceptions, or overreactions. Another common type is complex trauma, which is exposure to different types of trauma and multiple traumatic events. So examples of this is like prolonged exposure to violence or bullying, prolonged neglect, series of home removals. So characteristics of what you might see in a child is denial and psychological numbing, disassociation, rage, social withdrawal, sense of foreshortened future. So they really just have a really negative, pessimistic attitude towards life, and it's because of the complex trauma they experienced. And then there's crossover trauma, which is exposure to a single traumatic event that is devastating enough to have long-lasting effects. So examples of this is like mass casualty school shootings, car accidents with fatalities involved, refugee dislocation. Characteristics that you might see in a child is perpetual mourning or depression, chronic pain, concentration problems, sleep disturbances, irritability. So that's the three overarching types of trauma. But then you break it down as chronic trauma, which is repeated or prolonged traumatic events, developmental trauma, which is impairment of normal development, growth, and ability to meet milestones. So you might see that more in the younger grades, where maybe they're not walking, talking, or maybe they have some regression. They were potty trained before they came to school, and then something happens and they start regressing, so they start having accidents. That's the number one sign of sexual abuse, is when a child regresses in that aspect. Intergenerational trauma, you don't hear about that too much, but I think it's important to include, especially in small rural areas, like generational trauma. Families experience traumatic events across generations, and similar traumatic events occur in future generations. Historical trauma, which is a cumulative emotion harm of an individual or generation caused by a traumatic experience or event. And then something that teachers probably experience is a secondary traumatic stress. Working with people who've been traumatized mirrors the symptoms of PTSD. Re-traumatization, the person interacts with another person or group who is traumatized in a manner that causes them to re-experience the trauma. So something triggers them to re-experience those same feelings, those same emotions as when they were initially traumatized. So two different events. The public traumatic event is like a shared traumatic experience and not usually attached to shame. So like war, terrorism, natural disasters, or crime. And then more the private traumatic event, which is the personal traumatic event, which is typically attached to secrecy and shame. They don't want to talk about it because they're afraid they've done something wrong, or they personally blame themselves. So that includes like sexual abuse or domestic violence. So going into fight, flight, and freeze, triggers, or also known as trauma reminders, are signals that act as possible danger. Leads to emotional, physiological, and behavioral responses, and their perceptions experienced as reality. So they may not necessarily be having a hallucination or a delusion, but to them, what they're experiencing is their reality, and it may be different than actual reality. And that comes on like with sights, sounds, smells, touch. Sensory is a very big trigger for people. For example, someone who's been sexually abused might smell the cologne of that abuser and not realize that they associate that cologne with that abuser, which it triggers all those memories, all those flashbacks, all those feelings, or a certain sound. I worked with a kiddo one time that when he went to a house, the doorbell was the same as when he went to the office, and when they opened the door, the doorbell would go off. So the house that he was abused in, he heard that doorbell, and when he came to the office, that doorbell was the same, so it triggered that. And it took us a while to figure out why he was so uncomfortable in the lobby. It's because that doorbell, unbeknownst, was triggering his trauma. So triggers or trauma reminders are mind and body connection sets in motion a fight, flight, or freeze response. Triggers cause an individual to experience fear, panic, dysregulation, or agitation.
Humans, like all species, have self-protective mechanisms to help us survive. Our fight, flight, or freeze survival response, the FFF for short, is designed to mobilize our brain and body to fight an enemy, run from an avalanche, or freeze to hide from a predator. Our brain sometimes misinterprets safe situations as dangerous and can set off false alarms. When the amygdala, our brain's watchdog, senses and responds to danger, our body enters survival mode quicker than our rational mind can react, leaving it trying to figure out why we feel in mortal danger. When the FFF alarm is sounded, we start to breathe more quickly and shallow, causing hyperventilation, and our heart starts beating very fast. These changes can cause strong chest pain, which many people interpret as symptoms of a heart attack, when in fact it's just a result of the FFF activation, which can be relieved through breathing exercises. As a way of getting you ready for action, blood is diverted towards the major muscle groups. Blood flows away from our digestive system, causing the bladder to relax, and we might feel the need to pee. The mouth goes dry, nausea can occur, and we get the butterflies feeling in our stomach. Blood also rushes from extremities, leaving us with cold hands, but often sweaty palms as the action-ready body starts sweating to avoid overheating. Legs and hands can start trembling and feel weak, while tension starts building in big muscles like the thighs, neck, and shoulders. In our head, FFF alarms cause our brain to focus on negative memories, probably so it can scan them to avoid danger and negative outcomes. We get tunnel vision as our pupils dilate to increase our focus and long vision, but as a result, we lose our peripheral vision. FFF activation also reduces our ability to recognize differences in facial expressions.
Too much oxygen and too little CO2 can result in dizziness or lightheadedness, which many people interpret as signs that it might faint. But because fainting is caused by a drastic drop in blood pressure, and because the FFF increases both our heart rate and blood pressure, it's nearly impossible to faint when this happens. Over time, depression, anxiety, and high levels of stress all harm the brain's ability to slow or cancel false FFF activations, causing them to happen more often. Knowing the symptoms of false activations makes it easier to recognize and reduce their effects. At Brave, you can learn both bottom-up and top-down techniques to reduce false FFF activation and bring your body back to balance. This video was created by Brave, building healthy minds. Humans like all species.
Okay, so before we get this, we've all experienced fight, flight, or freeze at some point in our life, right? Whether it's right before we give a big presentation, we see something traumatic, we have anxiety, different things. But imagine constantly living in that state of mind. Not just every now and then, but constantly living in fight, flight, or freeze. Fight, fight, or freeze. That's for kids who've been through trauma. That's typically where their mind stays at. Because trauma rewires the brain and it doesn't think rationally. That logic goes right out the window. And kids that have been through severe trauma constantly live in that state of mind. So of course it's hard for them to concentrate. It's hard for them to build social connections. It's hard for them to have probably good grades. So some trauma facts for educators specifically is trauma impacts school performance, whether it's a lower GPA, higher rates of absences, increased dropout rates, more suspensions or expulsions, and decreased reading ability. We see that a lot with kids who've been through trauma. We think they're senior in high school, they should be able to read. Some kids don't know how to read, and it goes back to the trauma. Sometimes they regress or they never really gain those skills.
Or just teaching them initially is a lot harder.
Yeah.
When they've been through trauma.
Yeah, and a lot of kids with the trauma tend to, there's a correlation between trauma and dyslexia because their brain is not wired correctly. So, trauma impairs learning. One single exposure to trauma causes jumpiness, intrusive thoughts, interrupted sleeps and nightmares, anger, moodiness, and or social withdrawal, which interfere with concentration and memory. Chronic exposure, which means repeated over and over, it affects the attention, memory, and cognition. So like literally their brain changes and they just can't. It's not that they don't want to, they really just can't do it. There's a difference between they can't and they won't. So, and a lot of times they get frustrated because they want to learn or they want to do a task, but their brain won't allow them. It reduces the ability to focus, organize, and process information, which probably makes it hard to study for a test, listen to the lecture, read the chapter, interferes with effective problem solving and or planning. So of course, all this combined causes anxiety and frustration.
It just takes a lot longer to learn.
Absolutely.
Yeah.
So we see there's probably, if someone wanted to study it, there's probably a correlation between IEPs and trauma.
Oh.
Trauma causes physical and emotional distress. Some things you might not realize, or you might, depending on how attuned you are to your students. Headaches, stomach aches, poor control of emotions, inconsistent academic performance. They may do really good one day, and then the next week they're not doing so well. They may do good one year, and then fail the next year. There's something going on behind the scenes. They could be unpredictable or impulsive behavior. There's over or under reactions to bells, physical contact, door slamming, sirens, lightning, sudden movements, just things that kind of trigger them. That book that, What Happened to You by Dr. Bruce Perry and Oprah, it's a good book to read. I just started reading it, but in the first chapter, I think it talks about a man who had PTSD, and he was out on a date and heard a car backfire that triggered the war that he was in, and he didn't understand. So it's not a matter of what's wrong with you, it's what happened to you. Intense reactions to reminders of trauma, thinking others are violating their personal space. So if you see kids that are constantly like, why are you staring at me? Why are you looking at me? Why are you picking on me? They may think that you are. Their perception is that you are, even though you're not. Blowing up when corrected or told what to do. I'm sure we all had a kid come to mind.
Yeah, can't raise your voice or they'll freak out.
I was about to say the tone of your voice too.
Yeah.
We typically label them as oppositional defiant and stick them in a category and most of the time don't realize there's something causing that behavior. Fighting when criticized, bullied, or teased. Resisting transition or changes. So it's really hard switching classes, having a substitute teacher. So I'm going to put in a personal story here real quick. My wife and I had twins. It'd be 8 years ago next month, and one of our twins didn't make it, and the other one did. She spent 4 months in the NICU. So even though we've never abused or neglected her, but in that 4 months, being born 4 months early was traumatic. She had a stage 3 brain bleed. She had eye surgery, heart surgery, had to have tubes in her lung, had to have a clamp in her heart. So just tons of trauma before she even was supposed to be due. Nothing that we caused or wanted to happen. But so fast forward, she did first steps. Actually, she worked with a lady that lives down here in Fredericktown. And then she started preschool, had 2 years preschool, and then went into kindergarten. Well, she had the same preschool teacher for 2 years. And it was somebody who really got to know her, really learned her triggers, and was able to de-escalate her when she got upset. Because she had sensory overload. I almost thought she was on the autism spectrum, but it's related to the trauma that she experienced. So fast forward to kindergarten, brand new teacher, already having a hard time adjusting, was acting out in class, not normal behavior. I mean, she would run, she tried to bite her teacher, she tried to hit classmates. So, that can't happen in a classroom. Very disruptive. So I went to the parent-teacher conferences and talked about trust-based relational interventions that I learned through my career. And that's basically something that if you guys move forward, becoming more trauma-informed, that's something that you want to look into. It's Dr. Karen Purvis. I can send you a link. But it's based out of Texas Christian University, and it is interventions specifically designed to connect, empower, and correct kids that have been through trauma. So, she had some behaviors at home, but not that extreme. She was getting sensory overload at school, changing the transitions and different things. And we actually ended up having to pull her out of school and homeschool her. And we actually pulled her out 2 weeks before COVID hit. So we were already homeschooling for COVID. And so fast forward almost 2 years of homeschool, and she no longer has those behaviors. But it's because we were able to dedicate that one-on-one attention. With homeschool, we have the freedom to stop, regulate, and then go back to the curriculum when we regulate it. Because when a kid is dysregulated, you're not going to teach them anything. You're getting into a power struggle with them. You're getting into just a mess, and it continues to de-escalate them.
I think that's why it's so great here, because we have 2 people in the classroom. So when we have a lot of times multiple kids having trauma at the same time, then that one person can, focus on those kids, and the other person can keep going with the rest of the class.
Yeah.
So it's very important, I think, to have, at least here, with all the trauma-based kids, 2 people in the class.
Absolutely. That way, that's very helpful. And it was nothing against the school. It's a school I graduated from, and so I know most of the faculty. What bothered me about that is they didn't listen to me. As a parent, they didn't listen to me. I knew my kid. I knew what I was told was, you're just projecting what you've learned at school, in your career, you're a therapist. This doesn't, your kid's not been abused and neglected. No, they haven't. But she had severe trauma, being born 4 months early and all the medical stuff. There's things that she just can't do. Getting her to focus is almost next to impossible if she's dysregulated. So nothing against the school, it's just they didn't have the time or the resources for that one-on-one attention that she benefits from. And it's not saying she's going to always be that way, because TBRI, what's great about those techniques is it actually rewires brains, and it's effective for teenagers as well.
Don't you think? I think we rewire brains here, actually, because
Absolutely.
we build relationships with
Yeah.
every single kid before we even, when we first walk in, like when school starts on Tuesday, we're all going to be standing back and building relationships with every single kid here. And they'll come in with behaviors, and 3 weeks later, they're great. We've got them all lined out. Not all kids.
Yeah, I was gonna say,
There's
some
very
that
few,
can't
very
fix.
few. We do still have a few, but for the most part, we at least here at school, they're safe. Their brains get rewired. It's just amazing but it's all about building relationships for sure.
It really is that connection.
And getting away from the environment they're in to come into.
Absolutely.
A lot of times, and I think it's later on in the presentation, school is a safe place for kids, because teachers and educators are in that field because why?
Because we want to.
Most of them are here for that, yeah.
Yes. every now and then you might have one that's not. We can all think of a teacher that probably was burnt out. But educators, social workers, they go into that field because they have a desire to help. So a lot of them have natural skills and abilities to connect with a kid. And one caring adult can make a difference in a kid's life. Okay, so these are kind of common signs of possible trauma that you might see across from pre-K all the way to high school. Separation anxiety and clinginess, regression or lack of progress in stages of development, increased somatic complaints like stomach aches, headaches, pains for no reasons, changes in behaviors, increased distress, anxiety, worry, fear. They may develop a new fear. The kid may never have been afraid of something before, but now they are.
Well, they get switched to different houses and, taken out of the environment, so that's going to create fear for sure. For
Absolutely.
us, for our situation.
They might start talking about violence, and they get really detailed, and it's almost like, what have you done? What have you experienced? It's kind of a personal thing. I think violent video games for kids who've been through trauma is not something healthy for them to spend a lot of time on. They might talk about death and dying, become really just obsessed with death and dying, distrust in others, difficulty with authority, hyperarousal, hypervigilant, avoidance behaviors. You might see emotional numbing, discomfort with feelings, and changes in social activities. A lot of really common in high school age kids is if they make a sudden change in friends or they drop some kind of activities they were really passionate about, chances are there's something happened that caused them to do that. And then sometimes there's not, because kids are,
You need to experience something different.
So I got this video that I really thought illustrates the difference between a learning brain and a survival brain. I don't know why this doesn't like to
Hey, welcome
go
back.
next.
Today, I really want to think about what's the best way to teach teachers about trauma without getting them distracted with all the technical stuff. And what's the most important thing for them to understand and learn. And I thought that the best way to do it might be to just make a difference between a learning brain versus a brain survival brain. So we'll just call it learning brain versus survival brain. And this is the difference. So learning brain is this brain that's open to learning new information, and it's completely okay with ambiguity and grace and vagueness, and it sees the big picture. It might pull back and it's on the balcony to look over the forest and figure out what's going on. On an emotional level, people in learning brain feel calm, peaceful, maybe a little excited about what they're about to learn, maybe a little playful and having fun too, and definitely curious. And they're not afraid of making mistakes because it's just part of the learning process. And so they're not really thinking about themselves. And they actually feel a little bit of confidence that if they just apply themselves, they might pick up what they're trying to learn. Now, survival brain, on the other hand, is completely different. It's hyper-focused on threat. It
doesn't like ambiguity. It wants clear, hard facts. It thinks in black and white terms. Doesn't want anything to be gray at all. And then emotionally, you can imagine that survival brain makes people feel panicky, feel like a little obsessive and afraid of doing things wrong. And they don't feel calm and open to learning new things. They just want to get things over with. And people in survival brain also really don't like making mistakes. And they are afraid of looking stupid too. So students in survival brain don't want to be picked on. They don't want to raise their hand and ask questions and look stupid. And so these people are also filled with doubt about their own ability to learn stuff. And they're afraid of other people to see how stupid they really are. Now it's really important to understand how learning brain and survival brain interact. Because survival brain always trumps learning brain. And it makes sense because survival brain is just trying to save your life. And so if it thinks that there's something dangerous happening, you better pay attention to it, right? But the tricky thing is that as survival brain stays on longer and longer, it's harder to get out of that. And it's harder to really go into learning brain. And the way I think about it is kind of like the myth of Sisyphus. You know that guy who has to push a rock up a hill, and then every day it falls back down and he has to do it over and over again. Well, being in learning brain is like being up on the high parts of that mountain. You can see the expanse of what's going on, but it also takes a lot of work to be up there. And at any second, if you're not paying attention and make pretty effort into it, it's so easy to slip back into survival brain again. And that rock that Sisyphus is trying to push up, well, that's kind of like stress. And the more stressed you feel, the heavier and bigger that rock gets, and it just pushes you back into survival brain quicker. Now, the kicker is that for traumatized people, stress is a really rigid and intense thing. And so with trauma, any little stress makes that rock grow way bigger than it normally would. And because people with trauma misperceive ambiguous situations as threatening and stressful, that rock just stays big all the time. Now, the good news is that the more you control stress, well, the easier it is to be in learning brain, right? Because that rock is a lot smaller. And what I really want to highlight for teachers is that the best way to keep students in learning brain goes back to why I spent so much time talking about attachment. Students best learn when they feel like they're safe and supported by the adults around them. So it's kind of like a baby elephant. You know how like on those nature shows, the baby elephant is like playing with leaves or exploring a tree or something like that and having a lot of fun. And the only reason why they can do that is because there's a whole group of mama elephants around that baby, protecting it and looking out for danger. So a kid with trauma or who's stuck in survival brain, it's kind of like that baby elephant who doesn't have protective adults around them. They can't play and learn because they're way too focused looking out for threat and danger. So this is why I really believe that the most important thing that schools need to focus on, way more important than any kind of techniques or curricula, is really whether or not they are creating that environment where students feel like they're surrounded by these big mama elephants who are going to protect them and watch out for them and make them safe. And when students have that, I bet you it unlocks their curiosity, their eagerness to learn, and play as a way to learn. So I hope that's helpful. Let me know if you have any questions in the comments below. Thanks. Hey, welcome.
So what I'm trying to get to transition, what are some things as educators that you do to connect with a kid and make them feel like that baby elephant?
We'll definitely make them feel safe in the classroom, and if they, come in not knowing how to read, they're not judged for that. They're taught slowly and at their own capability without having to reach everybody else's capability. I think that makes them feel safe.
Okay, so good point there, the feel safe, okay? So there's a difference in safe and then felt safety. Because you can have everything just right in the classroom and a kid still not feel safe. An example that we see commonly with kids that are put in foster care and they're moved around from home to home. And I use that as an example because that's some of the most traumatic experiences. Kids will hoard food. They'll take food to their bedrooms, or they'll, just for no reason, they may not be hungry. But if you offer them a snack, they're taking it and they're going to hide it. And the reason is because having that food makes them feel safe. Now you don't want the food in the bedroom, you don't want it hidden in their desk because of rodents and pests. But They do that because at some point they may have food insecurity. They didn't know where the next meal was coming from. So a common behavior is from to hide food. Something I've noticed in kids, especially in group homes, they will sell their snacks to get money to buy what they do want. So they may not like their snacks, they will sell them, so they'll hoard those snacks and then sell them to other kids to buy the food they do want. Or buy.
How do you correct the food hiding?
So good question. Something we practice at the home so at Peachaz we used to do level 4+ residential, which means it was the extreme kids, severe trauma, they could not regulate, lockdown unit. It was terrible. I didn't like it when I first started working there. We transitioned over to where we have one home that's more of a transitional living curriculum for teen boys, and I'm the therapist for that program. So something that we implemented is there is a pantry full of snacks that they know that they can go to anytime and get something. They may not go and get it, or there's a bowl of fruit on the table. So they know it's there if they need it. And it takes a while for a kid to relearn that I'm okay. But that felt safety is really important. Does that answer your question?
Yeah, I think around here we do that a lot. We have a lot of.
We have a lot of mama bears in our building, for sure.
So something I've learned with kids that are dysregulated, offering them water is a very unique and very simple thing to do. Because it refreshes their palate, rejuvenates them. Bubble gum, even though we hate it, bubble gum and double bubble, which is the hardest to chew, is the best for kids that are dysregulated because it takes their attention to that chewing and it stimulates the vestibular and the purgatory senses and just gets them focused. So, and back to what you were saying.
Yeah, I was gonna say, coming in into a nice environment where people are greeting them at the door and not overwhelmed by large classes and stuff like that. I think that makes them feel safe in our school. You guys think so?
I think it's building the relationships.
Yeah.
I come back to that in our middle school classroom. We build relationships and we're like grandma and grandpa. And it's just, you just get to know every single kid. And we've had lots of food hoarders. But we work through that and it's okay.
And if they need to talk, they have somebody to talk
Oh,
to.
absolutely. And that's something that they feel safe to talk to us. They anything about anything, boys and girls.
And the main reason they feel safe is because you build that connection.
Yeah.
They build that trust. Because a lot of times kids have been through trauma, they don't have that basic connection between two human beings that every person wants and needs to thrive. Because they're stuck in that survival mode. And in their mind, even though a person comes at them with the best intentions, they're thinking, when are they leaving? What are they going to do to me? What do they want? How does it benefit them? And it's because of their traumatic experiences. They don't mean to be distrustful, they just learn that behavior.
I think one of the biggest things for us as well is if a student has a behavior one day, the next day, that behavior, we start all over. I mean, that behavior, we don't bring back up. It's a fresh day, they have a new beginning, and every student knows.
I agree. We don't have any bad kids.
Right.
So I'm of the opinion there's no such thing as bad kids. There's kids that make bad choices based on bad experiences. Does that make sense?
Yeah.
So, all right, so back to what you were saying. Do you feel like you guys make a connection with them to where you feel safe to ask them a question? What triggers you? What would make you feel more safe? What can I do to help?
We do in fact do that for many of our students.
And we talk about it weekly as a school.
Yeah.
Okay, awesome.
And this is one thing that we're really working on. In this building, we're really set up to do great things. And they do great things in this building. And we want to kind of build on this, a lot of staff here are talking about, it's about building those relationships. We're trying to carry as much as we can into the rest of our K-12 environment. And I was thinking a little bit, reading a little bit about what you're talking about, that you have environments where kids do feel safe, and we have teachers that do build great relationships, but these kids are still anticipating those transition periods, whether it's the last 5 minutes of class, or it's lunch, or it's even going home, which is one reason I think we have such a strong population in our after-school program. Because a lot of those kids, especially the high school level kids, they want to be here. They'd stay here all night if they could. It's because of the relationships that we're building between our staff and our students.
That's really good insight. Something I recommend for you guys moving forward, and the reason why I didn't include it in this presentation is because in order to teach TBRI, you have to be a practitioner. So even though I've been through the training, I'm not able to teach that. I can talk about the techniques, but I did pick the brain of our TBRI practitioner, but however, she past couple weeks she's been on a ventilator with COVID, and so she wasn't able to really help me as much as she wanted to because she was, and she's only 35, so COVID, I mean, it's no joke, but she's really great because she worked at the children's home for years, and now she's in our training department, and the TBRI techniques. What comes to my mind, why I always go back to that, is like those kids that don't like transition. Literally having it wrote out on the board helps them feel at ease.
Yeah.
Having a schedule, giving it to them, they feel like they have some control over that transition, so they're able to transition better because they know. So like the bell's going to ring in 5 minutes, and you know the kid's triggered by that. You might just talk, say, hey, bell's going to ring in 5 minutes. You might want to start getting ready because they may need a little longer time packing up their stuff or whatever they need for that transition.
I do want to make the note that it's very important to make relationships with kids you don't 100% enjoy all the time. Whether they're a mess, they push your buttons 24/7, you still establish a relationship and make it known, because we have many kids that say, well, you don't care about me, and all we basically say is, no, we love you, we want you to do good, we're here for you. Even if you don't necessarily enjoy them, like I said, but you still make sure that they know that you're there and that you want to help them and that you love them. It
Absolutely.
makes a big difference.
The kids that treat you the worst are the ones that need you the most. Their behaviors are a clear sign of trauma. Just recently we had a new resident come to Harris House in Farmington, and ironically, so I work PRN at the hospital of Parkland doing mental health evaluations. So ironically, about a year and a half ago, they came in because they were suicidal, and they were really having passive thoughts. So I did a mental health evaluation. We decided not to hospitalize them because hospitalizations are just re-traumatizing kids. It's not really an effective method for kids with suicidality. So, but fast forward, we get this referral into our program, and I'm like, why does this case sound familiar? It was that case, because I ended up having to hotline the mom because she abandoned her child at the hospital, refused to take her home, and it's because the child, so behind backstory, they were put in foster care about a year and a half. Their older sibling had been murdered by their parents. They went through severe trauma. They don't even know the trauma they went through. And biologically male, but now identify as female. Really conservative family, not accepted by grandparents, not accepted by siblings. So constant thoughts of, I'd be better off dead, some past attempts. So when she first came to Harris House, it was in February of this year, she flat out looked at me and said, I don't keep a therapist more than 3 months. And I just looked back and said, challenge accepted. Because I don't give up very easy. Because those kids that treat you the worst need you the most. And they need to see someone who doesn't give up. Now, so from February to now, not only are we doing individual therapy every week, we have mom engaged in family therapy, and we have siblings engaged in sibling therapy. And the goal is for her to go back home now that she has made behavior changes, because she had some behaviors that were not okay at home, that made things really uncomfortable. Mom had 5 adopted kids, really great heart, just at her wit's end, needed the help. So I say that the kids that treat you the worst have the most horrible behaviors. You have the best opportunity to make the biggest impact in their life, because you'll never understand exactly what they went through. That's one of the worst things to say to a kid, is I understand, because in their mind, you don't, and typically we don't. But building that connection that you guys are talking about, making them feel safe, and not giving up, even when it gets hard. Because it is so easy when you have a kid, and there's been times where I thought, I don't know what's wrong with this kid. I don't know, they don't have these factors, they don't have these risk factors, they have a lot of protective factors. They have parents who care about them, they have a stable home. Why do they act this way? Well, then you start getting them into deeper into therapy, and you realize there's trauma before that they don't remember. From about age 5 and under, kids don't remember things very clear. So then it comes out in behaviors, and it comes out in dreams, in nightmares, hallucinations, and different things. So kids have been through trauma, and it's really hard not to compare kids to each other, but we really can't. Because a kid has been through trauma, their brain, something is not wired correctly. So there's sometimes I go back to it, they can't behave. It's not that they don't want to, they literally can't. So it takes a lot of de-escalation and regulation with them. So, I have some more of that. But I found this article that I wanted to share because it puts these are from a kid's perspective. Kids who experience trauma are not trying to push your buttons, even though they are. That's not their intention. Kids who have been through trauma worry about what's going to happen next. So back to that transition stuff. Even if the situation does not seem bad to you, is how the child feels about it that matters. So when we look at traumatic events, like a car accident versus a rape, okay, a broken arm versus depression, we can see that physical impairment, right? We see the cast, we see the healing process, but then a kid who's been raped or molested, we don't see that pain. So we think they just need to get over it, right? It's a common thing, just get over it. But it's not that easy. So, or a kid that stubs their toe, that could be traumatic. They may get over dramatic, but that could trigger something else. So really, like when a kid discloses trauma to you, try to have an open mind and see that while it may not be traumatic to you, it is to them. Okay. Trauma is not always associated with violence. Sometimes kids, they neglect. They don't get the proper nutrition. That's trauma. They're left at home with no caregiver. That's trauma. And then, of course, the important thing is you don't need to know the trauma in order to help. It helps to know the trauma, but you don't have to know it to help. Kids who experience trauma need to feel that they are good at something and can influence the world. There's a direct connection between stress and learning. Self-regulation can be a major challenge for students suffering from trauma. Again, it's not that they don't want to, they just can't. And they need maybe some co-regulation. It's okay to ask kids point blank, what can you do to help them make it through the day? They're the expert in their life. You can support kids with trauma even though it's outside your classroom. What you do here impacts them out there. I've worked with a lot of kids that age out of foster care, and we keep tabs on them. And they may be 10 years down the road, they come back, and they know it's not necessarily the therapist or the case manager that made a difference. It may have been a direct care staff that always smiled at them, always gave them an appropriate hug, that made the difference. So don't underestimate the simple things that we do. Does that make sense? Mm-hmm. All right. Have you guys heard of adverse child experiences, also known as ACE? Sometimes referred as an ACE score or an ACE score. Results from the ACE studies are often utilized in trauma-informed care to identify at-risk groups. The data supports the development of integrated trauma response approaches. And the higher the ACE score, is the greater the risk.
Someone's experiences early in life are important building blocks for the developing brain. Genes, nature,
are like the blueprint. They provide the basic framework for brain development. However, genes do not design the brain completely. Environmental influences, nurture, fine-tune how the brain works by shaping which brain connections get used. Connections that are used more grow stronger and more permanent, whereas ones that do not get much use fade away. Together, genes and the environment build the foundation for all future development. Safe, stable, and nurturing relationships early in life lead to healthy development. But children's brains capture other experiences as well. Stressful events. However, not all stress is bad. Positive stress involves normal childhood experiences, like starting daycare or meeting a new person for the first time. This stress is essential for healthy development because it helps children develop coping skills and confidence. But when stress is frequent, chronic, and uncontrolled, it is toxic to children, especially when they do not have a caregiver to provide support or help with the stress. Adverse childhood experiences, ACEs, such as abuse, neglect, exposure to intimate partner violence, parental depression or addiction, and poverty are toxic stressors which can lead to lifelong changes in learning and behavior. ACEs early in development can impact social, emotional, and cognitive functioning, increased risk-taking behaviors such as drinking and substance use, and increased risk of disease, disability, and social problems later in life. The question is, how do adverse childhood experiences impact a lifelong development? One of the most important systems in our body is our stress system. It's activated when we experience stress. We become alert, our heart rate increases, and so do our stress hormone levels, cortisol and adrenaline. Our body is ready to react, what is known as fight or flight. A short period of time after the stress is over, or if a child receives support from a caregiver, the stress response turns off and the body returns to a normal state. Adverse childhood experiences create stress responses that stay active, and without the support of a caregiver, the system has difficulty shutting off completely. This constant and prolonged activation can affect immune system functioning and increase the chances of sickness, infection, and disease. Prolonged activation of stress hormones is also toxic to the brain. Certain areas of the brain are more vulnerable to toxic stress, including the executive center, or the brain's control center, an area important for solving complex problems, attention, reasoning, impulsivity, inhibition, and learning. A second area is the emotional center, the brain's alarm system, which is involved in processing and interpreting emotions and the ability to control impulses. The third area is the memory and learning center, the brain's filing cabinet, which plays a major role in learning and the formation and retrieval of memories. Science shows that adverse childhood experiences impact all of these brain centers. Behaviorally, what we begin to see is emotional distress, poor emotion regulation, greater impulsivity, learning difficulties, and physical and mental health problems. More recently, science has begun to look at how ACEs cause changes in gene expression through a process called epigenetics, which helps us understand how nature and nurture interact. Epigenetics causes changes in the way genes work without changing the DNA code itself. This occurs through chemical changes influencing how the code is used. In other words, genes are like the hardware in a computer. They determine the boundaries of what is possible. However, we need an operating system to tell the hardware what to do. Epigenetics is like the operating system directing the function of the gene's DNA hardware. The genes we are born with are the genes that we have for life, but experiences like nutrition, exercise, smoking, stressors, and relationships all affect our biology. Adverse childhood experiences are associated with epigenetic changes related to stress, brain development, cognition, and systems associated with mental and physical health. Changes that happen early in brain development are more likely to be enduring and are possibly passed on to future generations as well. The good news is that positive, supportive relationships at any stage in life can make a difference. However, supporting families and children early on will help prevent many of these negative outcomes. One of the key ingredients for healthy development is having warm, loving, and actively engaged caregivers. This involves promoting serve and return interactions, where caregivers actively and warmly engage with the child, making eye contact, responding to sounds, words, gestures, emotional needs, and sharing experiences like reading and play. Providing programs that support caregivers to strengthen these abilities are the blocks that build healthy foundations for life.
Okay, so I'm trying to get this transition. How many, you guys heard of brain mapping? So that's something kind of newer. It's not being widely used, but we're seeing a lot more used through the zoo is helping a lot with kids in foster care do brain mapping. And what they've been able to find is what it's talking about here. You may have a teenager, but when they experience a trigger or traumatic reminder, their brain really goes back to like 5 or 6 years old, depending on what it is. So you may have what you think is a high functioning teenager, but when they feel triggered, they go back to some of the behaviors from early childhood. So I want to do an exercise. I pulled some questions that are commonly used for adverse childhood experiences. And then there's 13 questions. And what I want you guys to do is a simple yes or no. You don't have to share your answer out loud, but if you want to keep a tally mark of how many you say yes to. And we're thinking about these experiences when you were 17 and younger. So an adverse child experience from 17 and younger. So, first one is, did a parent, guardian, or other household member spank, slap, kick, punch, or beat you up? Or did a parent, guardian, or other household member hit or cut you with an object such as a stick or cane, bottle, club, knife, or whip? So it's a simple yes or no. You answer yes, like put a tally mark or something to keep track of how many times you answer yes. Question number 2, did a parent, guardian, or other household member yell, scream, or swear at you, insult, or humiliate you? Or did a parent, guardian, or other household member threaten to or actually abandon you or throw you out of the house? Number 3, did someone touch you, fondle you in a sexual way when you did not want them to? Or did someone make you touch their body in a sexual way you did not want them to, or you did not want to? Or did someone attempt oral, anal, or vaginal intercourse with you when you did not want them to? Or did someone actually have oral, anal, or vaginal intercourse when you did not want them to? Question number 4, did you live in a household, or did you live with a household member who had a problem with drinking or misused street drugs, whether it's marijuana, cocaine, abused opiates, some kind of abuse of a substance? Number 5, did you live in a household, or did you have a household member who was ever sent to jail or prison? Not even say, even go to say what the cops called your house, those type of things. Number 6, did you live with a household member who was depressed, mentally ill, or suicidal? Whether you know for a fact, if you suspect they were, I would put yes. Number 7, did you see or hear a parent or household member in your home being yelled at, screamed at, or sworn, insulted, or humiliated? Did you see or hear a parent or household member in your home being slapped, kicked, punched, or beaten up? Or did you hear a parent or household member in your home being hit or cut with an object such as a stick or cane, bottle, club, knife, or whip? Number 8, were your parents ever separated or divorced? Did your mother, father, or guardian pass away? Number 9, did your parent/guardians understand your problems and worries? Did they really know what you were doing in your free time when you were not at school or work? So were they actively involved in your life? Did your parents or guardians not give you enough food, even when they could have done so? Or were your parents or guardians too drunk or intoxicated by drugs to take care of you? Or did your parents or guardians not send you to school when it was available? Number 11, were you ever bullied? Number 12, did you see or hear someone being beaten up in real life? Did you see or hear someone being stabbed or shot in real life? Did you see or hear someone being threatened with a knife or gun in real life? And the last question, were you forced to go live in another place due to any of these events we talked about in the further questions? Did you experience the deliberate destruction of your home due to any of these events? Were you beaten up by soldiers, police, militia, or gangs? Or was a family member or friend killed or beaten up by soldiers, police, militia, or gangs? So, some discussion questions about this topic. And you don't have to share your A score unless you feel comfortable. But were you surprised by how high you scored?
Was it a 13?
Yeah.
There was one good guess in there though, wasn't there?
Yeah.
There was.
Yeah.
What if you scored low?
So the score doesn't matter as much as it's just a good indicator of high risk kiddos. But I'll just share my score out of those questions would have been an 8 or 9 from my personal experiences as a child. So just because you have a high A score doesn't mean that you're going to wind up in prison or dead or addicted to drugs or have ongoing mental health issues. But the A score, the higher the A score, puts you more at risk for those.
I was more surprised because it really wasn't my parents that made me have a high score, it was my sister.
Yeah.
So it's not necessarily your parents, it might be your terrible siblings, just saying.
And that's a good point. That's a very good point.
She just got married though, so she's out of our,
Out of our A school, yeah.
Okay. So when thinking about the A score, how does it change your perspective on trauma?
Anybody can have
Well,
a say.
it can happen to anybody.
Yeah. Did you think some of those questions were about trauma?
No.
But it depends on how the kid experiences that event. So someone, like for example, someone being spanked, okay, that may not traumatize one kid, but it may severely traumatize another kid. And it also depends on the severity and the aggression that's involved with it. Okay? So what can we learn from a child's A score?
How much they've been exposed to.
Mm-hmm. Can we learn like the trauma that's in their life? What else?
We can use it to come up with strategies and things to help them in our classrooms.
Absolutely. If you know that that kid has a high A score, then you can rationalize that their brain is probably not functioning 100% all the time. There could be some of their behaviors are a result of that A score.
I remember middle school, special ed teacher once say a few years ago that just wasn't an excuse. So she told me about a student. That's just not an excuse.
So you bring up a good point. So while trauma is not an excuse for a behavior, it's an indicator for the behavior. And we need to teach that kid how to respond better. Yeah. Can you think of anything else? What about the A score indicating, do we need to make outside referrals? Do we need to look at maybe non-traditional approaches? Do we need to kind of specialize with this kid's learning plan?
Counseling groups.
Yeah. Do you guys provide counseling on site?
We have,
Not a whole lot.
right, Faith Foundation has their own, but then we have,
School-based one, I think.
yes,
We have a
school-based.
school-based therapist that works in all the buildings.
Okay.
And it's scheduled through the week. It's a partnership with Southeast Community Counseling.
Okay, awesome.
And that's in this building. In the other buildings, they have social workers, counselors, and then the same, the out of school one that comes.
Okay. I know, so PCHAS, we serve Madison County. I can think of, I have a small caseload because I only do therapy part-time, but I know that I have 2 kids, one in the high school here and one that just graduated that I work with weekly. So, the reason why I asked about counseling and therapy in the schools is because I'm starting to see a big trend up towards St. Louis where they're having school-based therapists for like every building. One school I worked with sent one of their social workers to be trained in EMDR so that they could provide that right on site. Are you guys familiar with EMDR? So it is eye desensitization rapid movement. Or I say that backwards. EMDR. So eye movement desensitization rapid, something like that. I'm sorry. It's called EMDR. But basically, you can use your finger as a focal point or lights, and it triggers the trauma that the kid isn't aware of. And they actually re-experience it and learn how to accept it, process it, and how to cope with it. And what is neat about EMDR is when you get trained in that, they actually make you go through the process so that you experience what it's like. Because it has to be done in a very controlled environment because it triggers trauma that people have shut out or even before they can remember trauma.
I think we all feel like counselors here anyways. We all counsel every day, all the time, so we're just not certified.
Do you feel equipped to do it though?
Equipped, I've learned a lot, yes.
Yeah.
I would say I'm.
One of the best things to learn is from the kid. Like I said earlier, we never say, one of the worst things you can say to a kid is I understand, because automatically they put up a defense. No, you don't, there's a difference between empathy and sympathy. We don't want to feel sorry for them, but we do want to empathize with them and help them move forward. So, I'm not saying do an ACE score on every kid because it gets a little, as you can see, it gets personal.
Yeah.
But
You said something about 17, didn't you, if you've experienced
17 and younger, yeah.
So some of the kids are.
Yeah.
It'd be a lot for them to understand what we're doing. Some of them,
Yeah, and they have different questionnaires for age groups and different things. I just pulled a general one that covered different areas. But the good thing about it is, if you see a kid having behaviors that you just don't understand, that would be a good time to look into getting an ACE score. Because then you might be able to understand where they're coming from, why they're acting the way they are, and what kind of support they need. So this, what? Will it pull up that photo on YouTube?
It should.
Yeah, hopefully. There you go. Of course not. There we go.
Okay. This video is really good at explaining the ACE score and how it impacts long term into adulthood.
What we found in the ACE study involving 17,500 middle-class adults was that life experiences in childhood that are lost in time and then further protected by shame and by secrecy and by social taboos against inquiry into certain realms of human experience, that those life experiences play out powerfully and proportionately half century later in terms of emotional state, in terms of biomedical disease, in terms of life expectancy. In 1985, I first became interested in developmental life experiences in early childhood, really by accident. In the major obesity program we were running, a young woman came into the program. She was 28 years old and weighed 408 pounds. Asked us if we could help her with her problem, and in 51 weeks took her from 408 to 132. And thought, well, oh my God, we've got this problem licked. This is going to be a world famous department here. She maintained her weight in 1 several weeks, and then in 1 3-week period regained 37 pounds in 3 weeks, which I had not previously conceived as being physiologically possible. That was triggered by being sexually propositioned at work by a much older man, as she described him. And in short order, she was back over 400 pounds faster than she had lost the weight. I remember asking her why the extreme response. After initially claiming not to have any understanding of why the extreme response, ultimately she told me of a lengthy incest history with her grandpa from age 10 to age 21. Ultimately, it turned out that 55% of the people in our obesity program acknowledged a history of childhood sexual abuse. I mean, that's obviously not the only issue going on, but it was where we began. And as we went down that trail and we discovered other forms of abuse, also growing up in massively dysfunctional households, etc., the case study was really designed to see whether these things existed at all in the general population, and if so, how do they play out over time. We studied 10 categories of adverse life experience that were chosen because of their prevalence in the LEAD program. Childhood sexual abuse, heavy-duty childhood physical abuse, I'm not talking spanking, major emotional abuse, regard humiliation, 2 categories of neglect, growing up in a home where one of the members of the household was chronically depressed, suicidal, mentally ill, or in the state hospital, growing up in a home without both biological parents, growing up in a home where one of the members of your household was alcoholic or a drug user, growing up in a home where mother was beaten, growing up in a home where one of the members of your household was imprisoned during your childhood or adolescence. Those were the 10 categories. In a middle-class population, 1 in 11 people has experienced 6 or more of those adverse life experiences in childhood. So this is very common, totally unrecognized. It was difficult for us to accept their commonness, but on the other hand, these are issues that most people never touch. And so who would know without routinely asking? But at a so-called ACE score of 6, experiencing any 6 of the 10 categories that we studied, that person was 4,600% more likely to become an IV drug user than a person who experienced none of those 10 categories. Okay? Now, you think, you read in the newspaper the latest cancer scare of the week, prostate cancer or breast cancer increases 30% and everyone goes nuts. I'm talking 4,600% increase. The same ACE score of 6 produces a likelihood of attempting suicide that is between 3,100 and 5,000% greater than the likelihood of suicide attempts in someone with none of those life experiences. So the power of this relationship is enormous. So ultimately the question arises, how do life experiences in childhood end up with disease states a half century later? There are at least 2 big categories to account for that. One is through the use of various coping devices. One smokes to feel better, one overeats to feel better, one drinks to relax, etc. And those things carried out in heavy amounts have major destructive patterns, even though they may be immediately beneficial. The other broad category has to do with the effect of chronic major unrelieved stress on the workings of one's brain and central nervous system. In recent years, this is relatively new, it's become clear that chronic major unrelieved stress can produce the release of pro-inflammatory chemicals in a person's body, and also can suppress immune system function. Of the 10 categories that we studied, any 6 of them produces a shortening in life expectancy of almost 20 years. The magnitude of this problem is so huge, and the complexity of dealing with it after the fact is so huge, that realistically the only serious approach is going to have to involve primary prevention. No one knows how to do that, but it's the right question to focus on.
Chris, you want to take 5?
Yeah, so I was thinking, take a break, but before we do that, what do you think about the correlation between that A score of 6 to what he was talking about in adulthood?
It makes sense. I mean, you've been exposed to so much.
So then how important is it to provide early intervention for kids with those A scores?
Very important, obviously.
Yeah.
And that's one of the reasons why systems like schools and different organizations become trauma informed, because it helps you provide early interventions to maybe prevent that from getting to the point of some adults. Because suicide in teens is already high, but then the A score is 6, which 6 out of 10, it's not too bad, right? Doesn't sound too bad, but it really is. We want to pause this?
No, I wouldn't pause it.
Okay.
Yeah, I mean, I just went to the bathroom and I had to go. So.
For those of you listening to the recording, we're going to keep it recording during our 5-minute break if you want to fast forward 5 minutes on the video. Thank you.
I'm exhausted. I don't bother you. I am exhausted. This is
So it's kind of funny. She's like, you're going to the trauma is her sister. So that's what I said, because they wanted the dog just like that. So she's hopefully, not in our bubble anymore. So anyways.
It's funny, she doesn't
Like,
sisters.
Huh?
Oh, yeah, sisters.
Oh, yeah. Anyway, so yeah, I didn't want you to stop telling them that, but anyways.
So internet, there's
Yeah.
the landline, chemically.
And that's the thing, oh gosh, and now I think about my older daughter.
I have a phone now.
What you know is so traumatizing.
I built that one, they have cool ones now.
You know, but we don't see them like.
Well, my father was one of my grandma's house.
What did I do? You know, it just makes you think.
And that we think she shared with you.
Yep.
That's right. Everything off.
She shares everything.
My grandma does.
But no, you know, you just like, in anyways, interesting. But yeah, I think here we're just, it's really awesome. I went to high school before I came here. I worked in it for like 12 years.
Yes, I think you're.
And I have a relationship with kids. I'm not super good, so sitting in this, I'm really close.
I know the Burlington's almost cut the.
So is this church?
Yeah, it's like, it's taken its sweet.
I know, but the majority of
Maybe
them.
this is like,
Cover school kids, but.
Really?
I love behavior issues.
You know.
And that's what people need. Really get to sell this. Or the high school, especially to me, because I get high school agents and I just realize that research where you need to, they need support, you need to find them, you need to, you know what I'm saying, those are the kids that need to be. Because like the little kids that do something else, you know that you don't, but they're still disappointed. They still want to be loved and hugged at the same time they talk, but maybe they don't, I don't know, anyways, we've done a lot of, I should say a lot. And you're right, there's something in Tom every time. It just wants to if you can get back into the regular population. Yeah, a lot of kids would get here. They have IEPs, but they heard it all. You know, faith wants to keep.
That was the dog.
Yeah.
Because you were only down
Exactly, and that's exactly what it is. And although I love it, at the same time, all these kids.
Let me check
How many times those kids are over?
But think about it,
Our kids
it's
are
K through
excellent
5, it's
compared to
not,
those kids.
it's
So, yeah,
intermediate
they do
too,
have
they're
to-
all meeting at the elementary. So it's not, yeah. So it's
Oh,
not
yeah.
just-
Oh my gosh, they have such a bad name. Oh, the kids at Compass, they hated it there. I think it might be better now that Peaceful Valley is like, the good kids go.
The elementary days for,
Yes.
They're all the
Oh, okay.
Yeah,
because I didn't realize that was.
you know where we should have, or the ground.
Okay,
Okay,
yeah, come yesterday.
They go
What?
Oh, yeah. Oh, yeah. We've had,
Yes.
yeah, 3 or 4. 3 or 4, and they didn't come in that way. But they can come in, like, they just know that here is, they're still that residential, they're still those, you know, there's still those, you know, those kids with that trauma. Oh, yeah.
But yeah, we do, Wednesday, tomorrow, we start at 8:15 in the elementary.
If I get it, then I'll take care of myself.
And then we go back to the alt school for DCI.
What, say, how are you doing?
So, Can you say it one more time at 9? We'll be at 9:15, and we're going to the elementary for intruder training.
Okay.
We go lunch on our own from 11 to
Okay.
12:30. And then at 12:30, we go to DCI, which is various type of things, so I guess we go lunch, then 1 o'clock.
Treat my kids well. Very good, you know, I didn't know. And October 19th, I will go. You wanna go through my.
Are they all, like, they're all located in paper?
Yes.
It's on the Cape website or the RTDC. I'm taking two out of the making up to that
What
the last one I take is the Cape site. Early childhood, spend, I think the spend money. Communication club, I think they tell them, or they want to be.
They did.
So they're in the hour, I think it was, and stuff, I just see it as very important. And I'm gonna try to take it from that.
She's excited. No, right now. Either is Tyler's or he's our son. Well, there's another. And Tyler's the one that got him in the program. So I would start getting
Don't be any.
Yeah, I mean, yeah. That is.
And as soon as I can apply for the certification, I will.
Are we all here?
This is.
Yep, we're ready.
All right,
Yeah, we're ready.
Desi won't let me log in. You can't log in to Desi.
Oh.
Okay.
Okay.
I know, I feel like it was always the old people in my college class.
So I have a question.
Yeah.
So,
You too. I was
your
wondering.
twin,
Oh, were you at?
your twin at age 8 is Is that the age when you
It was his
homeschool?
daughter.
So our twins, so she'll be 8 next month.
Oh.
We pulled her out 2 weeks before COVID shut the schools down.
Okay,
And she was in
Sorry.
kindergarten, did you say?
Yes,
so
so
here's my question.
yes.
So you said, through no fault of the school, they just didn't have the time and the resources to help. And I would say that's common in every school. But what was uncommon was you were in that teeny tiny little fraction of a percent of parents who were in the circumstances where you had the ability to homeschool. So you were able to do that with your child. Okay, what about all the rest of those 100% who, most people can't do that. Most people can't take a child out of homeschool, so what happens to their children?
Yeah, so that's a good question. And my initial response is we need more funding for schools to implement mental health programs and to provide the resources for those kids. Because like I said, I was able to pull my kiddo out and homeschool her. Luckily my wife was homeschooled, so she knows how to, like, the experience. But not everybody can, because people who live in extreme poverty have to work. And while I was able to shift things around and work a full-time job and a part-time job, and so my wife can stay home, not everybody can do that. So it is a really good point. But my response is we need the government, we need our legislators to put more focus on how mental health impacts kids. Because if we have those early interventions, we can probably save the government a whole lot of money later on for adults, if they were able to focus on the kids' education as long as, kind of like a dual, we're really good about co-occurring disorders, mental health and substance abuse for adults, putting that together. How come we can't do that for trauma and mental health for kids?
But part of the problem, I would think, would be based on the parents that these kids do have are not gonna be supportive of them going through special therapies and stuff.
Right.
And then it's reinforced when they get home again.
Yeah, so, and there's things that schools can do, and maybe, I guess we get you looking at becoming trauma informed, right? So along that process, there is building blocks to help make your school more trauma informed and implement sensory, we'll get to this later, but a sensory room. So one thing that bothered me about them, well, they didn't listen to me. I know my kid, I know the interventions at work, they put her in a room by herself and lock the door. Basically a closet.
They did my son has autism, they did the same thing in St. Charles. Yeah.
And that was my breaking point. I was like, okay, you're re-traumatizing my kid instead of listening to these very simple things. Because one thing that works with her, and I'll talk about it a little bit later, is when she's getting dysregulated, get her up, and you guys are about to do it, spin, and it gets that vestibular sensory, what she needs, and she's able to sit back down and focus. But the problem with the small school I went to, which you guys are comparable size to the school I went to, said I wasn't going to name it, but no one said anything, but I graduated from Kingston, which is between Tosi and Soto.
Yeah.
So very small school. They advanced in some aspects, but they didn't have, so it was one teacher to 20 kids. And that was just one classroom. There's other kids in that district that they meet the requirements for a paraprofessional, but they don't have the resources to provide it.
That's here too.
Yeah. So at the risk of sounding political, it goes back to funding. If we're going to support these kids and help them become healthy adults, we have to get early interventions and start when they're young so that we avoid those, because the kids with high ACE scores are going to be more at risk for doing risky behaviors like substance abuse. And it's just generational. If you don't get it.
Repeating cycles.
Yeah.
So is the Secretary of Education in the state of Missouri, I'm sorry, I said I was going to stop talking. Are they having this trauma-informed training like we are? I mean, I just feel like they need to be the ones, the people that are making the budgetary decisions need to know as well.
So something that we can all agree on is they have no idea what you guys are doing in the classrooms,
Right.
and they're making this decision. The same thing with my field. People that make the regulations or cut the funding have no idea what we're doing, and they think they're making good decisions based on the black and white paper.
Whoever's telling them something.
But they forget that under that number or those numbers, there's kids, there's future adults. You know, these are the kids that are going to take over our positions when we're older. So at the risk of sounding political, it really comes back to we need our government to focus on early interventions, and that starts with providing funding for schools to have more social workers, to have more counselors, to have resources to provide that paraprofessional. Or and a kid may not need it all the way to school. They may get that early intervention, have that paraprofessional for a semester, and learn the coping skills they need to function on their own.
The unfortunate thing is we don't have the funding. They do not fund us right now. So the purpose of us learning trauma informed is to give us the techniques to use in the classroom and help our students.
Sure, of course.
Yeah. In the future, we hope that we can make a difference. You know, I'm writing a dissertation on trauma-informed and special education, just like you had talked about earlier with the correlation. There is a correlation between special education and trauma. So just hopefully in the future, somebody can make a difference and get that changed for us.
Yeah, and it starts with one small step today, and then building on it. Something I didn't mention, and it's relevant, but in St. Francis County, I'm the president of the Mental Health Board. And one thing we are working on in that county is to get a meal tax or a child service tax passed. And essentially what that would do is provide more funding for agencies to provide more services for that at-risk population. So like a child service tax is a sales tax. It's like a quarter of a penny, but it has the capacity to generate millions of dollars a year. And that the funding could go to schools, or like, are you guys familiar with Great Minds up in, they have a location in Farmington, Potosi? They're actually putting a school-based therapist into Farmington this year.
But St. Francis County votes for bills, but Madison County doesn't.
Right.
Just so you know, that's.
Yeah, no, well, no.
They don't vote for schools.
Yeah.
Didn't even get a Billy bar down here.
So this is,
No, you can't even get a bill bar anymore.
this project that we're working on is gonna be an uphill battle, because as soon as you say tax, people think, oh no, it's my money. But a sales tax, actually, if the commissioners, and you guys get more familiar with your commissioners, but in St. Francis County, 68% of the sale revenue in that county comes from outside counties. So educating the voters on that, that's not their money, but it's going to support those kids. But a lot of surrounding counties come to Farmington for services because that's where a lot of the major providers are. So again, at the risk of sounding political, it goes back to funding. We put a lot of money into things that go nowhere, and we neglect the most vulnerable populations that we have. And in my mind, kids are, that's my passion. Kids are no offense to adults, but I don't care to work for adults. I see more hope in changing generations if you catch that kid when they're younger. Because you're not just impacting them, you're impacting future generations and breaking the cycles of abuse and neglect and trauma. So does that answer your question? Kind of.
He forgot to guess it.
But it takes evidence-based practices to get funding, but then it takes funding to get evidence-based practices. So it's like a cycle of where do we start? Well, we need to jump in and start somewhere.
Yep.
Before we go on with these activities, does anybody else have a question?
I will say we are fortunate because most of our teachers already utilize many of these techniques and things in their classrooms. So I think we're doing very well. Just being able to learn some new things and
I always thought they should come from the other buildings and come over here and just watch us. I just think just the way we greet the kids, the way we talk to the kids, the way we deal with things, I just think it would be helpful to be like, oh, that's cool, or oh, I never thought of that.
Yeah, well, I just saw on Facebook that Potosi School District is implementing a
I saw
sensory
that.
room.
Yes.
And I thought,
A
yes.
sensory room. It had a lot of, it was pretty big.
The neon board though is not.
Oh, so they did sensory.
I thought you said sensory.
They de-escalated.
Yeah, so when they're
things like that.
dysregulated, they had like swings in there, but there's simple things you can do with a sensory room. will do wonders for a kid that's dysregulated, because that's what they need. A lot of kids have been through trauma, have had their sensories neglected. So whatever it is, meeting those needs help them regulate, which corrects that wiring in the brain that got disrupted by trauma. So when I saw that, I was like, wow, because
Yes.
I'm from that area, so I'll say it. Potosi is not known for letting outside things into their school. So for them to jump into this, I was really excited for those kids. So.
And it probably took just the one person that really was passionate about it to get it going. So somehow, some way, absolutely.
Yeah. So yeah.
That was my first thought when I saw it, was like somebody.
So it was nice. My only critique is that billboard that had all the neon colors, probably not the best colors for a kid that's dysregulated. That's gonna amp them up.
Yeah.
So, all right. So I have a few activities I want to do with you guys to kind of simulate what a kid feels like when they're dysregulated. So if you guys, for the first activity, what we're going to need is a sheet of paper in one hand and a pen or pencil in the other. So you're going to want to stand up, hold the sheet of paper out with one hand, and then with the other hand, write your name and home address, but not providing any support.
What? You're writing your name and address.
Yeah, with no support. So away from where the paper where your hand's at, like where there's no support from the paper.
Oh. That makes a difference.
It's easier when you have more than one page to it.
Yeah.
Yeah, I think we.
Oh.
Yeah.
So if we didn't have more than one page.
Oh, I couldn't do it at all.
No support. I'm gonna try it. Oh my gosh.
Oh, yeah.
Come on, Mallory. Put your
I can't. My new address, yeah.
It was a piece of front-loaded.
So good. I'm trying it with one sheet now, it's very, very hard.
I can't even do it.
Nope.
So how frustrating is that?
That is frustrating.
You know how to write, you know your name and your address, unless you just moved. Why not? But trying to accomplish that simple task, how frustrating is it?
That is really frustrating.
So that kind of simulates what a kid feels like when they're dysregulated and we're asking them to focus on schoolwork. It's kind of hard. So what that does, that's the proprioceptive difficulties, and that's for kids, you see that really with trauma. Okay, so the next thing, you might want to make sure you're not close to a desk or something so you don't fall. But while standing, with your arms stretched out in front of your body, stand on one foot and hold it for 20 seconds.
I don't have good balance.
Just a few more seconds. Okay, there you go.
You're
All
doing
right.
arm circles.
Now do it with your eyes closed.
Oh.
Same foot?
Same foot, yeah.
Okay.
A little less harder.
Oh.
I'll give you for about 3 seconds.
Oh,
Okay,
gosh.
now switch feet with your eyes closed.
Oh. Nope, one now. Uh-uh.
Okay, so how'd that feel?
Oh,
Horrible. Frustrating.
Okay. So that is like vestibular. That's the liquid in your ear. If that is messed up, that could cause you to be dysregulated. So with my little girl, we have her spin, which helps kind of get that sensory that she needs. So one more. Okay, so this one might get a little dangerous. So with so spin around 6 times and then try and walk a straight line.
I can't walk a straight line, that's a minute.
Say how bad it is.
That's six.
That's practice.
It's been so fast.
Oh, gosh.
I'm just now on six.
Yeah.
I know.
Did you do it work?
I did.
Hey, you know, it's,
Little dizzy though.
I'm sorry.
Oh, I'm still moving in it.
All right, so how did that feel?
It's organization.
Yeah.
Drunk.
That happens in schools too. But imagine feeling like that all the time and trying to accomplish some of the most simple tasks in your life.
Not always.
No. So kids that have been through trauma feel that way constantly. So, and there's more activities I can share with you guys. I went to the ones that didn't require you to get really close. All right, so now we covered trauma, talked about the ACE score. I want to talk a little bit about the benefits of becoming more trauma-informed and then getting into more details of becoming trauma-informed. So the benefits is individuals and systems gain an understanding of widespread impact of trauma, learn to recognize the signs and symptoms of trauma in others, integrate trauma knowledge into policies, procedures, and practices, and prevent re-traumatization. So if we broke it down to 4 simple things, those are the main goals of trauma-informed. So some definitions though, trauma-informed is a change concept or paradigm shift in knowledge, perspectives, attitudes, skills regarding the impact of trauma. A trauma-informed system that makes an intentional shift towards using trauma-informed knowledge to guide policy, procedures, practice, and decisions at every level of the system. So when you think of a school system, what systems do we have in play? Not just the school as a whole, but what systems are inside the systems? Yeah.
Oh, what was the question?
So with the school system, what other like subsystems are there in the school?
I would say different grade levels.
Grade levels,
Buildings.
buildings, special education, counseling, discipline policies.
You have your PDS, PDIS teams, your interventions, exactly. Those interventions could be academic, could be social emotional. Those are things we're building towards. But those are things you find in schools that with tiered systems.
Yeah. And then you think about the hierarchy, okay? The school board, the administration, the support staff, the teachers, your paraprofessionals, the cooks, the janitors, all that. Bus drivers. Oh yeah, bus drivers see some of the worst things because the morning time, kids probably didn't sleep very well and they are not happy to be on a bus ride.
They see him at the first time.
Yeah. And on the way home, they're tired and they're cranky. So when you talk about trauma informed, it's really training even bus drivers and the lunch crew to be more trauma informed. Because you going through, I don't know how you guys do your lunch here, but if they have to remember their number and they're dysregulated, they're gonna get more frustrated trying to type that in. And then they're gonna get embarrassed, run in the bathroom, not eat, and then go to class hungry and can't focus. Not saying that happens, but that's a very common thing. So trauma-informed treatment is the evidence-based treatment approaches that are specifically designed to deliver individuals that have exposed to trauma. So the overarching principles in trauma-informed is safety. So ensure the physical and emotional safety of who you're working with. Recognize and respond to how minority populations are impacted. That's another thing. What works for one person may not work for somebody in the minority because there's different levels of support, different levels of empowerment, different privileges that come in play there. So you got to, when you think of trauma-informed, you have to really think a general thing is not going to work for everybody. But how much diversity do you guys have in school?
percentage?
We're about 94% white.
Yeah.
And most of the non-Caucasian are probably from the group home.
Yes.
I would say.
A lot of them.
Yeah. We have a lot of diversity here in our.
Yes.
So, yeah. So that already comes with different risk factors. And it's going to be harder for them to connect with somebody that they don't relate to.
Yeah, you're exactly right on that.
So so in Farmington, there's a little more diversity, but since I work with kids in foster care, I see a lot of diversity. I remember back when I did the Chafee program and I come down to Faith Foundation and would see kids there, a lot of the complaints I would hear from the African American population is they didn't fit in.
So that surprises me that we're 94%. That just surprises me. Wow.
We're just slightly, like, the community is about 96, I think, was the last census.
Yes, more this, we might have quite a bit
Now,
disbanded.
your building, I'd like to add that up. It's probably 75, you guys know, 75% white, probably.
Yeah.
So a lot of the underlying issue with foster care is a lot more minorities go in foster care because of the lack of resources
Just the.
and the generational cycles.
And they used to always be down south, but now they're moving the,
From Kennett.
yes, they're coming from Kennett area down there. So
I was just gonna say, just dealing with the hair situation. I mean, like,
yeah.
they have to go into a place where somebody don't know how to do their hair.
Yeah, nobody in town does. Yeah.
Freaking out about their hair. And
Yeah.
stuff like I can think of.
I'll connect you guys with somebody.
Yeah.
I have a person.
We're hoping somebody in town.
Yeah,
is
I
really
think the house is doing pretty good.
Yeah, they used to have to take them to Poplar Bluff to get their hair done, so it never got done. So.
Well, there's a guy in Farmington.
Farmington that does, yeah.
Oh, great.
It-
Maybe
I
possibly.
think whether
making
the
a
house.
Yeah.
deal-
But that very basic thing like that.
Yeah, and that's important to them though.
At Peach down in Texas, they held a class for foster parents just on how to take care of ethnicity here.
Uh-huh.
Because down there in Texas, there's a huge population of Hispanics and African Americans that are in foster care. So then the next thing is trustworthiness. You have to build genuine relationships and practices that build trust, maintain appropriate boundaries, and develop norms that promote reconciliation and healing. So boundaries is really important part of trauma informed because a lot of kids who've been through trauma don't know what healthy boundaries are. So even though it's hard to set boundaries when you really want to connect with that kid, it's good to set, it's healthy for them to set some boundaries. But they may take them a while to comprehend them and understand the importance of them. Understand and respond to ways explicit and implicit powers impacts the development of trusting relationships. So like that power and privilege. Identifying and mitigating internal biases and acknowledge historic power in majority populations. Choice. Maximize choice by addressing how privilege, power, and historic relationships impact both perceptions about the ability to act upon choice. I'll get more into that when we get into like dysregulation or de-escalation techniques, but choice is one of the most powerful things you can do for a kid who's been through trauma because it gives them some control over something. And you can give them healthy choices to where they're choosing something right either way they go.
Yeah.
Collaboration. There's a lot of value in transparency and self-determination, minimizing the impact of intent and power differential, maximizing collaboration by sharing responsibility for making decisions. So aligning with the person. And then empowerment, encourage self-efficacy, identify strengths and build skills, recognize and respond to the impact of historical trauma and oppression. So those are the key principles behind trauma informed here in Missouri. So actually the Missouri model has 4 different stages. And so the first one is trauma awareness. So receive training to become more aware of the prevalence of trauma, begin to consider how trauma may impact the people you're serving. And then there's trauma sensitive, where we build the consensus around trauma-informed principles, begin utilizing the knowledge and applying it to practices, and then a team is usually formed to help move the organization forward. So you identify those movers and shakers in your system, and who's passionate about trauma-informed, and those are your cheerleaders. Those are the folks that are educating everybody else on it.
Yeah.
So then you move into trauma responsive. begin implementing the changes in routines and infrastructure at all levels of the organization. Trauma-informed services, screenings, crisis response, and staff trauma are being addressed. Now I'll get more into staff trauma in a little bit. And then trauma-informed. There's implemented trauma-informed practices become the norm. All aspects of the organization reflect being trauma-informed. Ongoing evaluation helps sustain the progress and keep up-to-date practices in play. So then there's some steps specifically for schools. And the first one is universal trauma training, which is kind of what we're going over now. It builds common vocabulary, identifies champions, builds readiness in subsequent changes. So this is the trauma awareness stage, but in step 1. Step 2 is creating a trauma team, which is more in the trauma sensitive area. So typically, when you see schools forming teams, it consists of somebody like a principal, the instructional coordinator or curriculum coordinator, school counselor and or social worker. Not all schools have social workers. You guys do, right?
Not in our building.
Not in your
but
building.
Any other buildings,
Okay.
yes.
So not to negate counselors, but social workers and counselors need to work together because they're trained differently. And having them work together as a collaborative force is something to be reckoned with. Because social workers are trained a lot in broad areas to where you cover like a holistic and systems approach. And a lot of counselors are trained in one specific area, which makes them very knowledgeable in that area. Does that make sense?
Yeah.
Classroom teachers, other teaching and support staff, parents, students, school nurse, and community partners. So when you're forming a trauma team, you need to reach out to community partners. So what are some of the community partners in your area? Like in Fredericktown?
I mean, we have community counseling. I know that they're kind of difficult to get in. That's kind of the problem we have in our community is, if you make an appointment, it's usually months in advance. And so, but I mean, we do have community counseling and those types of services for our parents.
Okay.
I know my sister has a program, I think she's introducing in this school, Strengthening Families program.
There you go.
Yeah, that's more focused on junior high kids and stuff, but that's something they're trying to put in.
Well, and being healthy and healthy eating. I know a few years ago we had someone from Mizzou here in town.
Missouri Extension.
Yes, Extension.
Which is the Prosperous Street family.
Yeah.
Yes, they bring in different people.
The extension centers are always great resources for.
Yeah. But other than that, I can't think of.
Okay.
But like I said, we're trying to expand a little bit. But they're in the process, community counseling's process of writing a grant that will fund for us to have a second therapist for school.
Awesome.
Which will relieve some of the stress. Another thing we did was, we don't have a social worker in this building, but I know that with the staff population, student population, I'm not saying we couldn't use one, we probably could. But right now, I think they're keeping that above water best they
And
can.
plus, those kids get therapy all the time. I mean, they receive therapy on a daily
Oh,
basis.
But we did add, so we had one social worker for both our all K through 5 for 2 buildings. And she retired this year. Oh, she loved the fact that we had to replace her with 2 people. So now we have one social worker in each elementary building.
Okay, that's awesome. So a school up north of you guys decided to get rid of social workers and hire more SROs. Now they're regretting that choice, and they've got a contract to hire a social worker for one social worker for the whole school, which is gonna be a lot for that person. But there's value because those social workers, there's usually a huge network of social workers because they go to school together, they are in cohorts. So when they graduate, they go to work at a school, they go work at community counseling, they go work at BJC, different areas. So having that network, and I'm sure it's the same with counselors. I just don't know, I'm not too familiar with counseling networks. But knowing, well, that's how I got connected to Jamie. Somebody I went to school with knew Jamie, and Jamie contacted me. So, but there's also other community partners, your legislators, your representatives. Those folks need to be involved too. They need to know what you're doing, why you're doing it, and how they can be involved. Who's your representatives down here?
Holly Ryder.
Holly Reeder and Rick Francis.
Okay, so I'm not familiar with them, but Dale Wright, who's in our area.
Dale's one of ours. I get confused.
Dale, okay, so Dale is. So
Yes.
Dale is serving on the Health and Mental Health Committee for the state. So he's a perfect person to be talking to about, and I tell you, he has a personal interest in mental health because his family has experienced suicide.
He's a former educator as well.
Yeah. So he's somebody the mental health board is
Social
working with to get some changes done with policies.
I'll say too, you mentioned SROs, and I think they can be a valuable resource in this. And, and I think, in our capacity, our SROs are not here to sort of discipline. They're here to keep the schools safe. At the same time, we involve them a lot in conversations with our kids about making smart choices. Another thing is if you pick the right SROs, you can communicate with them because they may have a little bit of family history about certain students. And any little bit of information you can get that deals with how they deal with the public in general helps us to provide supports to kids. So I think they're very valuable. We're fortunate that we have 4 of them here.
Absolutely.
Yeah, and they can really, SROs can make or break a situation. But the con of the police department and different things is they are trained to go in and control the situation. Sometimes it makes the situation worse. So getting them trauma informed or CIT, the crisis intervention teams training is huge for them because I work with a lot of police officers and they'll tell you, we're not trained how to de-escalate. We're trained to go in, cuff them, get them out of there. When really a lot of that could be avoided, especially with kids, it re-traumatizes them.
And we require all our SROs to training in the summer that's specific to, and you'll notice that a lot of the sessions that they're providing, the training they're providing, are helping them to understand what it means to be a police officer in a school setting.
Because it's different.
And I think for the most part, our guys do a pretty good job of understanding. They're not just there to do traffic.
They build relationships.
We want them to build relationships too.
Yeah.
Like all of that.
It's awesome. Community partners, I mean, that really is a broad, it could be a retired teacher, it could be a retired person who has time to commit to helping. A lot of your volunteers, you find that they're passionate about it, they'll do more work than somebody's paid to do it. So step 3 is the ongoing program, practice, and policy change, which includes the stages of trauma response and trauma informed. So you examine all practices and policies through the lens of trauma. So it means looking at disciplinary policies, all those different policies that impact the kids through a trauma lens instead of just a normal lens. So there's changes in knowledge, practice, culture, policy, and systems. So once you get to step 3 and more trauma informed, it becomes the norm, it becomes the culture. The most powerful resource for young people is a supportive, unwavering relationship with an adult. So from a holistic approach, a trauma-informed should not feel like a program to implement. It is better described as a shift in how programs are implemented and evaluated. So saying trauma-informed isn't necessarily getting rid of everything else. It's combining trauma-informed practices with your current practices and looking at them through a trauma lens. Because you say we say we're putting in a new program, a lot of people are like, not again, here we go.
Yeah.
But trauma informed is not meant to be a new program. It's supposed to come alongside and change the current program. That makes sense?
Yeah.
So trauma informed schools provide safe and supportive environments for children to learn and educators to work, include the impact of trauma into daily practices, program design, policy creation and implementation, and overall the culture. There is literally a fundamental change in the way it works to promote healthy, resilient educators and learners that are capable of disrupting the cycle of trauma and creating more equitable outcomes. Because that's one of the biggest things of being trauma-informed is making a level playing ground, making sure that this person who's been through trauma has enough resources to be able to be on the same level with everybody else. Have you guys seen that picture on Facebook where it had like 3 people looking over a wall, and one was tall enough to look over,
Yes.
the other one was on boxes and the ladder, and then there's a new one going around where they just removed the wall. I kind of think that's what trauma informed does. it removes the wall. So examples of strategies that have been implemented in other schools that have been successful is universal trauma training, community building practices, prioritizing staff needs, changing disciplinary policies, creating space to regulate, like a sensory room, and then connecting with the community, really drawing on the community as a whole, as supporting the school and the change. So key points to keep in mind on this journey is success is a process, not necessarily a destination. You'll never be able to say we're completely trauma informed, because trauma is always, there's always new evidence-based practices coming out. There's not a single definition or checklist to make sure that you're trauma informed. A school must develop their own sense of accountability, strengthen relationship with community resources. I can't stress enough how much community resources will make or break a trauma-informed school. No two schools are the same, and they need to be vastly different. Even your neighboring schools, the needs are going to be different than they are here. The rural versus the urban, the public versus the private. There's going to be vast difference between schools. You will see differences in what your elementary building needs compared to your middle school and your high school and the alternative. And that's okay, because the overall goal is to improve the health and well-being of students and staff in the learning environment. So we talked a lot about trauma and all the terrible things that trauma causes, but resilience is the ability of a child to recover and show early and effective adaptation following potentially traumatic event. School can help children build resilience by providing a positive social environment, working to foster and develop a child's cognitive skills, and promoting student safety and belonging through support of school staff. Factors that enhance resilience in children: support from parents, friends, family, school, and community. Resources that help buffer negative consequences of daily life. Feeling safe at home, school, and the community. Having high self-esteem. And if you find a child has low self-esteem, start building it. It's going to help them become more resilient. It's going to help them overcome challenges. Possessing a sense of self-efficacy. So there's a fine line between like helping and enabling. So with trauma informed, we want to teach kids the tools to regulate. We don't want to always necessarily change the environment. It's case by case, because taking a kid out of the environment and putting them somewhere else isn't necessarily going to change that behavior. But teaching them how to regulate and maybe some co-regulation skills will help. Having a sense of meaning in their lives. For a lot of kids, their success is school, getting that grade. They may never get any recognition at home, but when the teacher recognizes their improvements or their grades, then that's a sense of worth. Possessing talent, skills in certain areas. I think you guys can all attest that kids have certain skills and abilities that they excel at, and some that they don't.
And you need to let them know they're doing a good job, or you can do a good job at this. Or,
yeah, and
you don't have to focus just academics.
Yeah. So a kid that's really creative in art,
yeah,
foster that, because it's going to help them build resilience in other areas. Possessing a variety of adaptive and flexible coping skills. So preventing re-traumatization, I think one of the most important things in trauma-informed is this right here. And how educators can prevent re-traumatization is learn as much as you can. Get on that level, know what the kids' triggers are, and what coping skills that help them successfully regulate. What works for them, because not one coping skill will work for everybody. It's not a cookie cutter type thing. Grow your skill of attunement, which is the capacity to read cues and respond appropriately. Look for causes of behaviors, like what is the behavior communicating, what need is going unmet. Use person-centered and strength-based approaches. How many of you guys know what a person-centered approach is? Anybody? It's basically what it is. It's person-centered. You're developing that strategy and that plan based on that person. Okay? And then strength-based approach, that's a shift from a deficit-based mindset to a strength-based mindset. What are they good at? If you ask a kid their strengths, they're going to struggle to tell you. But if you ask them their weaknesses, they can pop off a whole list. What's the reason behind that?
Because they go focus on their deficits and not on their strengths.
Because as human nature, we focus on what needs fixed, not what's going well. But with the strength-based approach, you can use what's going well to help them overcome the obstacles that aren't going well. Avoid labeling terms such as victim, damaged, or broken. View and empower them to be a survivor. One of the worst things a survivor of child abuse wants to be called is a victim. Because once they process that trauma, they take that power back and become a survivor. So labels are a huge barrier between connecting and connecting or empowering a kid. Focus on what they can do and not what they cannot do. And then provide consistency, predictability, and choice-making opportunities. Meet them where they're at in that moment. Connect with them on their level. So in TBRI, if a kid is in the floor throwing a temper tantrum, TBRI teaches you to get in the floor with them. Get on their eye level. Don't bring them up to yours. Get on their level and connect with them where they're at. Provide a sense of safety that reduces anxiety. One thing with that is healthy touch. And when we say healthy touch, that may be, depending on the kid, but it may be a side hug, a pat on the back. You know, some kids, probably younger kids, holding a hand gives them a sense of security. So a healthy touch, whatever is safe and appropriate for that kid. And then give choices. Because choices get us some control. So like, going back to when we talked about the food insecurity, you know, they were hoarding the food, but then you gave them a choice of, here's the food in the pantry, it's here, you don't have to hoard it. That makes it, or a bowl of fruit. So you're giving them two choices to choose from, both are getting the result you want, and their needs are getting met. Always weigh the physiological, psychological, and social risk of any physical intervention. Least restrictive options utilized in each individual situation. So something you guys probably hear a lot from the kids in group homes is they've been restrained. And TBRI teaches us how to de-escalate a kid without having to restrain them. Now there are some kids that have to be physically restrained because their behavior is so out of control that it becomes a safety hazard. But every time we do that, it does re-traumatize them. But there are points where you have to physically contain a kid to keep them safe and to keep everybody else safe. But putting hands on a person can trigger them, causing the situation to escalate. And then one key piece is debrief. Make debriefing a priority after every crisis situation to identify potential patterns and triggers for that kiddo. It will prevent future crisis situations and helps that person feel supported and develop resilience and coping skills.
We used to have an intervention room, and that was why it was so important down there. It was a way for them to debrief, to de-escalate.
We don't have it anymore?
I'm not sure, but it was great. And then they came back to class, and they were calm. And
Yeah, so you're not just debriefing with the kid, you're also debriefing the staff that was involved.
Mm-hmm.
Oh, absolutely.
What did we learn about that? What are you feeling right now? Because when you have to go hands-on with the kid or you have to deal with a crisis, your emotions are in that too.
Mm-hmm.
So learning to accept those and process them is part of debriefing.
Well, I think it's important also to have, like you said, the trauma team, but also just having a team with the other teachers, because there's sometimes you can't handle a child, and we go and grab another teacher who can, and it makes a total difference. I mean, sometimes we kind of have to say, yeah, we can't do this alone, we have to have help, and that's why I enjoy our building, because we have that. I'm able to go to a classroom and say, hey, I need your help, and I'm not afraid to ask for help because I know I can't do it all. So I think that's why it's important to have.
it's not just physical help either. It just might be, help with
De-escalating a kid, talking them down.
Right.
It goes along with building relationships with any student, whether they're in your classroom or not. You know, and in this building, every single person has a relationship with every student in some way, shape, or form. We all know.
So a good
every
point.
student in this building.
A good point to make with that is like tagging out, because sometimes
Yeah, I like that thing that you shared about that folder where you could just have a colored photo folder and say, can you go give this to so-and-so, just to get them talking to other people and, and they think they're doing something important.
A
because
job.
they're getting a
Right.
job, but it's just to get them out of the situation and there's
That's,
really nothing in the folder.
And nobody
it's
knows
just-
anything,
Yeah.
anything different, they're just delivering a message.
But the teacher knows what it means,
Yeah.
so they know.
Or the like a purple folder team or something.
Yeah, I like that.
that's really neat. Sometimes you may trigger a kid and they don't know why. You may resemble their perpetrator.
Exactly.
You may be a personality conflict. That kid may not be able to connect with you. And it's okay if they connect better with somebody else. That's part of the debriefing, is realizing, hey, this kid and I always, we have conflict. I can't connect with them. Somebody needs to.
And it's okay to say, I can't connect with a kid, but have someone else do that, and that's totally fine, it's
Yeah.
okay.
And then on the other side of the spectrum, sometimes we get too close to the situation and we're blinded by what's going on.
Yeah.
And then we get to that point where we're enabling the behavior.
Right, you get too close to a student or whatever, and, yeah.
And it happens to all of us. We can probably all think of somebody where we wanted what was best for them, and we kind of overlooked some things. So, all right. So some de-escalation techniques that I wanted to share that we find really helpful is listening to music, reading, writing, and drawing, getting that kid refocused, walking or stretching, talking with a peer or staff, breathing exercises, using a cold pack. How many of you guys know about the vagus nerve?
The what?
The vagus nerve.
It sounds familiar.
It's not your.
I've heard it, I don't know where it's at.
So it runs behind your ears and down
Oh,
here, and putting an ice pack right there stimulates that and helps the kid regulate. And I also recently learned that you can have the kid do it, but rub behind the ears, because it also stimulates that nerve.
I think we do that.
Yeah.
A lot of times that when our kids are all hopped up, they try and put a cold pack right there, just wouldn't work.
Yeah.
Or listening to music, they start screaming, or,
Yeah,
I
and
don't know.
you gotta find what works for them.
Yeah.
So the essential oils, people were really big about that.
Yep.
But if you notice, they rub that behind their ears. They may not realize they're stimulating that vagus nerve.
I think another problem with some of these is, in our setting, we're not talking about a kid possibly having a behavior issue occasionally. We're talking about most of the kids that walk in our classroom having them every day. And so when Johnny and Susie are taking time out to listen to music, and Bobby's putting his hands under cold water, and Joey's got an ice pack, oh yeah, we're supposed to teach also.
Right.
So we have to every now and then actually teach, and so this, I think, that's a big thing here also. If you don't just find some way to make a connection with them and get past, you wouldn't believe how many times a day, especially the new ones, this is my coping skill.
Yes.
My therapist helped me do this. Really? You just got a yo-yo out and you think that's cool? No,
Yeah.
we're not yo-yoing
But
class.
use it as an excuse,
Yeah.
No, the
My
coping skills have to be appropriate.
Yes, yeah.
Well, even if they're appropriate.
Yeah.
There's just,
Well, and
you don't have time in the day for every kid to take an hour out of the day for coping.
Yeah, well, it typically doesn't take an hour to regulate. If you find what works in a few minutes, they don't need to be listening to music for an hour. Then they're crossing that line over. They're abusing it. So, but using a cold pack, weighted blankets are really good for sensory. That deep pressure. Fidget toys and sensory toys. Fidget spinners can be dangerous in the classroom, but just having a stress ball to squeeze.
I use a little toy car and they just roll it in their hands. Well, we've done the things where you put Velcro underneath your desk where they just rub the Velcro. And what else do we use? Putty?
I had stretchy things, bands,
Yeah.
I had a kid that would chew, we're not allowed to chew
Those little
gum, but I
balls
let
with
him
the
chew
flower
gum.
base, so that means those-
Yeah.
Lego shoe
Balls.
toy. They
Oh,
chew
yeah,
on
we
that
had a Lego
constantly.
shoe toy.
Yeah, hung together.
I think they come this from home.
No, we bought it.
We went through about 5 of those chew toys and then we got through math, so.
Well, it was better than.
Yeah, I know. I'm just like,
And you can make sensory toys really eat. The Orbeez and balloons can make a stress ball.
Yeah.
oh, yeah, there you go.
And
We made them out with sand before too, so
Sand.
a balloon or flour.
shaving cream is a good one.
I think at grade level as well.
Mhm.
We can't have stuff like that in middle school because they take advantage of that.
No. But you can teach them grounding techniques, healthy touch, putting hands underwater, wall pushes, having somebody like do a wall push, helps them regulate, spinning, relaxation, meditation. It's something you guys can figure out what works best in your classroom, what works best for the kids in your area. Because maybe doing some meditation before you transition to a new subject may help.
Or just allowing for
Yeah,
a
we
little
did
bit
deep
of
breathing.
downtime where you're not rushing to get ready for this.
We did deep breathing for a
But the
while,
thing
for
is,
like
if
5
you do
minutes.
it with one student, they're all gonna wanna do
I
it.
was
So
gonna
that's
say,
why we
that's
need a
why
place
we
to
have
take
to hold
that
that.
away from the
We
situation.
do have a place to take that. That's one thing that is good about our building. We do have an intervention room.
Well, we did.
We still have an intervention room.
Okay. Okay.
And this would be very great for us to be able to use. So.
Yeah, if you're just wanting to get one kid out of this situation.
And we've got the kitchen, we've got plenty of rooms. If we need to take one student and de-escalate them for a few minutes, this is perfect for that.
And that's one thing with these techniques is you find what works and what works quick. And a lot of times getting them outside the room with somebody else is what's best. Because they feed off of everything else going around them too. Because once they get that attention, negative attention is a lot better than no attention.
Absolutely.
So that it amps up. So. All right, here's one of my favorite ones that I teach kids and adults because you can do this and no one knows what you're doing.
Hello everyone, I'm Anna from Franklin County Cares and Lutheran Family and Children's Services. And no, I'm not really a superhero, but I thought it would be fun. This is the first video in our grounding series, and today I will be introducing you to the 5-4-3-2-1 method. So, what is grounding anyway? Well, it's a set of simple techniques that you can use to detach yourself from difficult emotions like anxiety, sadness, or anger. Grounding provides a healthy distraction to prevent you from being overwhelmed by emotion, while still paying attention to your body's cues and senses. You know the brain fog that comes on when you get stressed about a task you have to complete, and how that fog gets in the way of completing that task? Well, this method can help you. And that's because this method works on getting you out of the amygdala, where emotions can take over, and into your prefrontal cortex. So, let's get started. Here's a breakdown of the steps in this method. We'll go through them quickly now, and then we can talk about each step in a little bit more detail. This method uses sensory exploration to distract your mind from whatever is upsetting you. You will identify 5 things you see, 4 things you feel, 3 things you hear, 2 things you smell, and 1 thing you taste. First, we are going to focus on 5 things we see. Don't overthink this, just find 5 things in the room. Maybe it's the bookshelf across the room or your cat staring out the window. It doesn't really matter what 5 things you choose. Just make sure you choose 5. Describe them in detail, either out loud or in your head. Take that cat by the window, for instance. What is it doing? What color is it? Does it have long hair or short hair? Is it asleep or is it awake? Is it licking its fur? Maybe it's eating. Describe it. The next step is to focus on 4 things you can feel. Maybe you can focus on the chair you are sitting on. Is it soft and fuzzy or hard and cold? Or maybe you can think about your shirt. How does the fabric feel? Do you feel hot or do you feel cold? How does the carpet feel under your feet? Now we will focus on 3 things we can hear. Can you hear a dog barking outside, or maybe your dog is barking at the door? Do you hear a car starting up or driving down your street? Maybe it is completely silent around you and you can just hear your own heartbeat. Focus on the sounds. Next thing is 2 things you can smell. Now, hopefully you have some pleasant smells around you. Maybe you have a fresh pie in the oven. I know. That doesn't happen very often at my house either. One thing I smell a lot though is fresh laundry. So what does that smell like? Now this last one just so happens to be my favorite because we get to focus on one thing you can taste. Maybe you have a piece of chocolate or your favorite soda. I want you to savor whatever it is. Then think of words to describe the flavor as if you're trying to tell someone that has never had it before. As I talked about previously, we can use this technique to distract our minds from whatever negative emotion seems to be taking over in that moment. Whether you're feeling sad, worried, angry, or even scared. So use this whenever and however much you need to. And that's it. This video was brought to you by Franklin County Cares, the Franklin County Community Resource Board, and Lutheran Family.
Okay, can I get a volunteer to do this technique? Okay.
Morgan, you're volunteering?
No.
Is that your hand?
I'll do the first one.
I'll do whatever.
Not this one.
Oh, okay.
Sorry, no.
What are we doing?
No, the grounding technique. So look around the room and name 5 things you can see.
Yeah.
Okay, you do that.
Yeah. Do I need to name them out loud?
If you will, yeah.
Okay, smartboard, posters, the door, a clock, people.
Okay, what are 4 things you can feel?
Oh, I gotta do all of them. Okay, my feet are cold. There's a kind of hard on my chair. Let's see, something else. I can feel my arms on here, my hand resting. Did I name them or not? I think that was
That's 4. What are 3 things you can hear?
Us talking, some people in the background, the blower when it comes on.
Okay. 2 things you can smell.
They don't smell much of anything. Usually some sort of fresh scent in your room, and my own breath in my nose.
Okay.
That's rough.
Yeah.
And 1 thing you can taste.
Right now,
Well,
or just something I like to think about.
something you can think about in this point.
Okay, like a fresh brewed glass of tea is refreshing.
Okay. So what that does is it gets the kid's mind, and the adults use it too, off of the current situation.
Yeah.
Because if it doesn't work the first time, go back through it again with them and make them name different things. Because then
Focusing on something.
it gets harder to name 3 things you can hear. It gets to the point where they're like, I can hear my heartbeat,
Yeah.
I can hear the computer running, and it helps them focus. A lot of times it helps to have like a mint or a piece of chocolate. I had a kid facilitate a group one time, and their whole thing was that last one. Different types of chocolate and describing how you can taste it.
Yeah.
So it's something that works for them.
And it's quick. It could be a quick activity.
Yeah. Because chocolate, most people like it, but it also releases endorphins and makes you feel better. So something I like to teach people to put with the grounding is while you're doing that, also incorporate deep breathing. Take the deep breath in your nose, hold it, and let it out your mouth quick, because that stimulates the oxygen in your blood, which helps get things regulated.
And actually, they teach those breathing exercises at the preschool.
Yeah.
Because my son used to come home all the time and he would tell us about his letter 8 or number 8 breathing and all this stuff.
And so something I learned through COVID when we had to do telehealth was getting people to look up videos of like mindfulness meditation. Because there's 5-minute videos. You can get a kid to watch a video before you can get them to do something like that sometimes.
We did that for a while.
But there's trauma-focused CBT games you can have little kids play for a few minutes to get their mind regulated. So, one key piece that I want to include with trauma-informed is vicarious or secondary trauma and compassion fatigue. So this is more geared towards staff. Signs of this is reduced sense of efficacy at work, concentration and focus problems, apathy or emotional numbness. So if you see somebody who's always really passionate and they're just not, then chances are they're experiencing compassion fatigue. Isolation and withdrawal, they're usually social, but this is staff, not kids. Exhaustion, jaded, they become like a bitter pessimist.
This was us last year. I can say.
It really was.
It really was. This is us last year.
Yeah, on through everything, yeah.
Yeah.
I have a typo. Secret addictions, self-medicating.
We weren't doing that.
So self-medicating isn't necessarily taking a drug. It could be overeating. It could be not eating. It could
I
be.
did do that, never mind.
So
Sorry.
risk factors for this is being new to the field, having a history of personal trauma, working long hours or with a large amount of people, having inadequate support in place. So the reason why this is included in Trauma Informed is because a lot of times people who go into helping fields like education, social work, counseling, there's a reason why they go into those fields. They may have personal trauma that they may have processed. And working with that kid or the individual, it triggers that in yourself. And it's easy for this to weigh heavy on you. You go home and you're burnt out, you don't want to do anything. And I'm sure, this past couple of years have been really hard when you're told what you can do and what you can't do and all those different things. So I thought this was pretty applicable. I'm not a teacher, so.
That's definitely a skill I need to get better at. Self-care is hard, especially in this profession. However, my focus has been to get outside more, do more engagement with our environment. Cranking up the tunes in the kitchen, cooking something delicious for my family. There is more to life than just work, even if you really enjoy your career a lot like we do. I don't break records at home, I don't check my email very much at home, and I'm a better teacher when I have established healthy boundaries with work and leave work at work. So one of the ways that I practice self-care is being able to say no. Sometimes you have to be able to take a step back and refresh before going on to the next project.
1 minute meditations. I just close my eyes, take a deep breath, and try not to think too much about what happens. And when I open my eyes, I feel much better.
Try to turn your brain off and let it be quiet sometimes. Disconnecting from technology and distractions and spending time with other people that are helping us. Before you assist others with the oxygen mask, assist yourself first. I like to exercise and be with my family, but assist yourself before assisting others.
I think it's really important to give myself the time to be creative, even actually really digging in and researching is creative for me.
I play piano in the evenings, I read a book. I try to take time that is both being still and also being active. Spending time in prayer, practicing yoga, or even spending time outdoors, going booty stomping around the jungles of
Fresh air and movement are key to restoring my sanity and perspective.
I get up before anybody in my family when it's still dark outside, and I go to the gym on some mornings, or I go just sit and have some quiet time to myself,
Or I am going for a walk, or I'm reading a book, or I'm taking a nap on the weekend.
I practice self-care by traveling. Sometimes it's good to get out of our bubble.
My best mode of self-care is to learn from my students. I've learned patience, I've learned empathy, I've learned the latest dance move.
reach out to other teachers, share experiences, and have somebody to bounce ideas off of. It rejuvenates you and helps you reignite that passion for teaching.
Okay, so why do you think self-care is important?
You're trying to care for others, but
Yeah.
you're not
Can't take
caring for
care of others.
yourself.
If you're overstressed or if you feel inadequate, it's hard to be supportive for other people.
Yeah, that old saying, you can't pour from an empty cup, is literal. If you keep trying to pour from an empty cup, what happens? Causes more frustration, causes more discouragement. So what are some things that you guys do for self-care?
I like going for walks and being outside.
Listening to music.
I like to bounce ideas off coworkers.
What else?
Relaxing.
Having a long summer break to
Yeah.
relax. To collect ourselves and get ready for the new year.
So, in social work, we have practicums, like you guys have teaching,
They were called practicums as well, right?
are they called?
Are you talking about,
Like when you're in college and you do, like
Oh, student teaching.
student teaching, yes, okay. So I supervise practicums at my agency. And the first thing, whether they're a bachelor student or a master's student, one of the first things I make them do is a self-care plan. Because it is so easy to just go, not say no, and you burn out, and you end up causing yourself harm and causing others harm. So one of the key pieces of Trauma Informed is making sure that our staff are taking care of themselves and that they have the support they need. Because before you can take on somebody else's problems and help them, you also have to be able to be healthy. Does it make sense? So how many of you guys have a self-care plan?
I don't have a plan.
Never
It's
heard
not
of
written
that.
down, but it's in the mental mind, I guess.
So what happens if we keep it up here and we don't put it down somewhere?
Don't always practice it.
Exactly.
Do you have one of those you can share with us?
Yes.
I mean, as like a blank copy.
Yes, I do, because it covers, like, literally, you want your plan to include physical, psychological, emotional, social, professional, spiritual, environmental, financial domains of what am I doing in this area to take care of myself. And it always helps to have an accountability partner. If they see you struggling, hey, did you go for your walk today? Hey, did you go to the gym like you usually do? Hey, I noticed you were a little bit snarky in that meeting. Did you have your chocolate today? Whatever it is. So some tips is be aware of the signs. You know yourself better than anybody, and a lot of times we neglect ourselves and just keep going. So you know when you get to that point where you need to take a rest. Do not go it alone.
Something I notice about when I neglect my self-care is my students pick up on it.
Absolutely.
And it affects them and they get concerned about me and they don't need any more things to worry about, so.
It's a good point as well. Someone who's been through trauma is really sensitive to somebody else is going through
They're
something.
very sensitive, yeah.
Recognizing compassion fatigue as an occupational hazard. It's not a matter if it's going to happen, it's a matter of when it's going to happen. So that's why you put a plan in place so that you fall back on it. Because if this doesn't work, then you try this.
I use, and I've abandoned it, and I need to go back to it. I have a spreadsheet, and it's got the week, and I've got all the things that you need to do this week. One of them's read every day, something that's not related to my job. Exercise, 3 out of 5, or 5 out of 7 days this week. It's just kind of got a list of things, and if I do them, I'll put an X on there, so I can kind of keep track of, or am I doing it? It's also kind of a health plan too, like I had on there, like, less than 2,000 calories a day or whatever, which is not working for me right now. But it's there. I figured out that's the only way I'm gonna be able to do this is I have to. And of course, you said have somebody else keep you accountable. I probably should have shared that with my wife. I said, hey, take a look at this. And of course, I'm abandoning it, but now I'm sitting there thinking I'm gonna get that thing set back up and set some personal goals for myself.
And it helps to have that account, especially your spouse. If you're trying to eat healthy and they're cooking the most unhealthy things for dinner, or they want to constantly go out to eat, that's not helping you with your plan. So getting them to support you is a huge thing. But like I said, it's not a matter of if, it's a matter of when we burn out.
Yeah.
Because
you bring that negativity with you, you have it.
So I will say I'm one of the worst at not following my own advice. Before COVID, I was doing really well. I lost 80 pounds, was doing really good, and then everything shut down. The gym shut down. I couldn't go for walks. I was tied to telehealth at a computer. Because before I was going to schools, going different places, doing therapy, and then all of a sudden I'm to a computer and I took on more cases since I was not traveling. And during COVID, I was doing 30 clients a week, which is too much for a therapist because 30 different people you're taking on. So slowly but surely, I'm getting back to it. This is one of my on my self-care plan. I started out with the actual gallon one, but it's too big to carry around, and it gets hot really quick. So now I have a half gallon one that I fill up twice, and I cut out soda. So you got to figure out what works best for your body, what works for your spiritual. If you go to church, do you spend your time in devotion? Do you meditate? Do you do yoga? Do you just going for a walk in nature? Does that kind of figure out what helps you rejuvenate and put a plan together? And because you really have to be intentional with your self-care. Because if you're not, then you'll burn out. If you see signs in yourself, don't go it alone. Talk to a professional. So when we're in a helping field or education field, sometimes it's hard to ask for help ourselves because we think, oh, I help everybody else, I should be able to do this. Asking for help is a sign of strength. We're teaching others that, we have to embody it ourselves. So how many of you guys can put together a self-care plan and use it? Maybe pick an accountability partner and figure out how you guys can help each other. Because at the very core of trauma, everything I've read about Trauma Informed, it's take care of your staff. Because if you don't take care of those frontline people, then you're not helping. So self-care is vital to Trauma Informed and to this profession. So some of the references that I pulled information from was like Crisis Prevention Institute, Missouri Department of Mental Health, Star Commonwealth, the Missouri Model for Trauma-Informed Schools, the National Child Traumatic Stress Network, SAMHSA, and Mizzou. Mizzou puts out a lot of stuff that is really helpful. So that's.
Thank you.
Thank you very much.
Thank you. Just remember, trauma-informed is one step at a time.
Yeah.
It's like learning to walk.
Danny, what do you always say, Danny? You always tell the kids, how do you, what do you say? How do you? Oh my gosh, something about an elephant, no, what is it? A piece of cake?
How do you eat an elephant?
There you go.
One bite at a time.
Yeah, I still say that all the time.
One bite at a time.
So, does anybody have questions? Or you?
I think you did a great job.
Yeah,
I appreciate it. Let's see if I can get this.
Oh yeah.
So we're just coming back here at like 1:15 because I'm. So I come back. Is it 1:15? Is it like from 11 to 12? No, it's 12. Is that what it's supposed to be?
No, we're back there at 12:30.